Good morning. The Finance Committee meeting is called to order. I have 9:31 a.m. on Monday, April 15th. Those in attendance are my colleagues, Alderwoman Finlayson to my right and Alderwoman O'Neill to my left, as well as Alderwoman Pindall Charles and Alderman Arnett. At this time, I believe we have an agenda that we need to approve, if I'm not mistaken.
Madam.
Good. I move to approve the agenda.
Second.
All in favor signify by saying aye.
Aye.
Okay. At this time, we have the meeting minutes. No, we already approved. There was no meeting, so we're good to go. All
No,
right.
the agenda, you approved the agenda, and then it's the minutes from last meeting.
They haven't been approved. We didn't have a meeting, so.
320.
Oh, okay.
Yeah.
Oh, right. We need to go back 2 meetings and approve the meeting minutes from March 20th. Do I have such a motion?
Madam Chair, I'll move approval of the minutes from the March 20th meeting.
Second.
All in favor signify by saying aye.
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 Aye, thank you. All right, we've elected to just focus on the budget and kind of postpone any sort of pending legislation. A couple of things I just want to say as far as housekeeping. Thank you for being prompt. And in response, we'll try to keep to our schedule as well. All of us have questions, I assume. Just be cognizant of the time. And if we don't get our questions answered, what we're going to do, or we don't have time to ask those questions, we will get them to you in writing, and you can respond directly to me, and I will get them to the right person, and Kaylin is going to keep a log of those written questions and answers. Okay. And as far as just keep in mind that this is the mayor's budget. It is not ours yet. It is the duty of the Finance Committee to review the budget and then present it to our colleagues with our recommendations. The budget has to represent our policies. This budget basically did not involve us at all, so we all have our own interests to address. So we will be asking some specific questions. It's one of the positive things about having such a good budget and line item detail is that it does open the door for more questions. So I really appreciate the work that you guys put into this. So without further ado, we have the fire department scheduled, and it's an hour slot, and you can begin your presentation, make your introductions, who's at the table, etc.
Good morning, Doug Romali, Fire Chief. Madam Chair, members of Finance Committee, and alderpersons, thanks for having us this morning. To my far right is Deputy Chief Matthew Lopez, who is in charge of administration and professional standards. And directly to my right is our Fire Administrative Specialist, Jeannie Coughlin, who helps us maintain our daily operations within the fire department. So I will work through this presentation that we have for you. If you have questions as we're going, if you want to, just let me know, but I'll try to breeze through the presentation so that we can get to the questions and answers, because I'm sure that's the biggest part of what you're looking for.
Yeah, I forgot to mention that. We'll save the questions till the end of your presentation.
Okay, that's fine. So here's our mission statement, and the fire department exists to provide a safe environment for the community by minimizing the impact of fire or injury through public education, quality service, emergency preparedness, and overall cultural safety. Safety is our #1 goal in the fire service, not only for our personnel, but for the public, and that quality service is what we strive to achieve every day in the fire service. Here's a basic organization chart. As we fall under the city manager, then to me is the fire chief, and the fire department's broken up into 2 sections. As I just stated, Chief Lopez is in charge of the administration side of it, and Deputy Chief Powell is in charge of the operations section. Some highlights of our current budget: we maintained our ISO Class 1 rating. We were just recertified last year, or re-accredited last year, however you want to look at that, but we maintained that rating. We completed the upgrades that you provided us funding for last year for all the stations with our alerting system, which is dispatched through Anne Arundel County. With fleet maintenance and your assistance, we were able to replace a special operations vehicle, which was a smaller vehicle. We were able to put this support vehicle in service. This was not a new vehicle. We went out and purchased a used vehicle to maintain that for this purpose, and it has worked well for us. We've implemented a new reporting system, which was in last year's budget. That is up and running. We are running through the challenges just like any other computer software where they're continuing to build that for us, but we are moving forward with that. And we completed an EMS audit. That was in the budget. We had to pay $30,000. It was a federal mandate to have this audit done because we provide EMS billing services. If we wouldn't have done that audit, we would have lost over $50,000. I think it was even higher in EMS billing. It was higher than that in EMS billing money. But that was a federal mandate. We've completed that audit. That was a one-time cost, and that's done. As with last year, you helped us improve our funding for our training. With that, we did some leadership training for all our unified supervisors. We've allowed for more people to be able to attend outside training outside of our area where they were able to travel to do some networking and training that way. And we are providing unconscious bias training for every member of our department. Some other highlights. Knock on wood, every time I say this, we haven't had a fire death in the city of Annapolis since 2010. We tried to maintain that. We've run over 13,000 calls last year, transported over 6,300 people to the hospital. What's important for us and to really have you recognize is that we do provide EMS billing, so people are charged for that service. And while we have a proposed $25 million budget, last year we brought in just over $3 million worth of EMS billing fees, so that helps supplement our budget there. We provided over 765 building inspections, fire safety inspections, 420 re-inspections, 222 permit-based inspections, fire permits, another 113 building reviews with their planning department or planning and zoning, 106 use and occupancy permits, and the fire marshal's office fees were collected about $120,000 last year. This is it. This is our core strategies. This is our goals. This is what you'll see with our performance standards that we look at. But firefighter safety is my #1 priority, and it remains that. But we, and I believe that most of you know, we feel we are very fiscally responsible with the budget that we provided. We want to maintain that training and education, wellness of our people, continuing to have that diverse workforce, and providing that outstanding service is where we try to achieve every day. So here it is to go along with it. As I said, the #1 goal is that firefighter safety. So our objectives are to reduce job-related injuries. Cancer in the fire service is a major concern throughout the United States. We're finding it more and more with firefighters. So we're continuing those initiatives to try to do everything we can do to prevent cancer in the fire service. So we continue to train our personnel and reduce our on-the-job accidents. Our benchmarks are there. That's what we do every month. We track our training hours. We track our numbers of active cancer cases within our organization, our accidents, and our workers' comp claims. And our performance measures are just that. It's the numbers of claims, the number of vehicle accidents we had, departmental accidents, our training hours, and so on. Second one is the main goal for providing the community a safe environment. So we try to do that through which our mission statement told you. Our whole goal or benchmark is to reduce the loss of property damage and injuries due to fires and injuries. And our performance measures are just that. We maintain that ISO 1 Class 1. We track the number of complaints we get, plus the number of thank yous, and our thank yous outweigh our complaints. We do not get a lot of complaints in the fire department, which we're very proud of, and it's the men and women that work for us that are the reason for that. And then monthly, we track our response times to see how they relate to national standards. And as you can see, that those are the national standards up there. Is how long it takes us to get a unit on scene once they go responding, and so within 4 minutes. ALS means paramedics. That's our advanced life support people. National standards, 8 minutes to have a paramedic on site, and then a full alarm assignment is for a standard structure fire where you have to have 15 to 17 people there within 8 minutes. So we track this on a monthly basis to do that. Our third goal is to maintain our daily staffing and the number of paramedics we have in the department. It takes us 25 people to staff every day for a 24-hour shift. So that's to staff all 4 fire stations daily, and that's what we need, a minimum of 25 people. We only have 30 people assigned to each shift. There's 4 people allowed to be on annual leave. That takes you down to 26.
You just said that too fast. Can you repeat that? Rewind about 2 sentences?
Sure, which it takes us 25 people to staff every day.
Okay,
We have 30 people assigned to each shift. So
got it.
with that 30 people, 4 are allowed to be on annual leave. So that takes us down to 26. That leaves us 1 spot for educational leave, other leave, sick leave, administrative leave, anything. And when it gets down below that, we have to pay overtime to maintain that staffing. So that's there. Our goal is to have 12 paramedics on each shift. We don't have that, but that's our ultimate goal, and that's what we continue to strive to make sure we have 12 ALS providers in that minimum staffing of 25 or 30 people on a shift. So our benchmark's just that. We continue to see where we are, and our performance measures are the soft openings. And what we mean by soft openings are the people that are on extended sick leave, our workers' comp claims, FMLA. We find we have a lot of that. When somebody's out on injury that hurts us when they're out for a period of time. So we track that, and we track the number of ALS providers we have. Our fourth goal is just providing community outreach. We do that through public education and EMS training. It's done throughout the department. Our daily crews go out and do some of the training. Any of the events or affairs that we go to that people ask for are done within that organization or the division that's needed. So if somebody needs CPR training, Your Life Matters training, it's done through the EMS section. Fire prevention training would be done through our fire marshal's office. So our benchmarks are just that, to have those training available, and then we track that training that we do monthly. Here are our long-term goals. It's to continue to maintain the upgrades to the fire stations that we have. The stations are getting old. As you know, we've talked about it over the last several years that the facilities weren't the greatest for our female employees. We hire more and more females. The fire service has a history of being a male-populated or dominated organization back years and years ago. Well, the fire stations were built that way. And throughout that time, with your assistance, we've been able to make some changes to that. We continue to do that. There's money in the current budget and the upcoming budget to continue to maintain that. I think the last go-around was the Eastport Station. The female facilities were redone, but the male facilities are basically falling apart there. So currently, we're in the process with procurement and Public Works to make some adjustments to that station. And what it'll be is, in the station side of it, where our personnel live every day, we're going to unisex restrooms, which will have a shower, toilet, and a vanity in there. Currently, while we upgraded the female facilities at Eastport, for our female employees, if they have to use the restroom in the middle of the night, they actually have to come out of where the living quarters are, or the bunk room, actually walk through the engine bay where the apparatus is to get to those female facilities. So by upgrading these bathrooms on that side of the station, that'll make this improvement, and they won't have to do that anymore. The female facilities at the Forest Drive station, this is a single stall, shower, restroom, and when you have 2 or 3 females working in a building at a time, that sometimes causes you problems. So that's currently being worked on. We actually have a design process that's already done, so we're working with Public Works to maintain that. But those are just some of the issues. The windows are getting old in the stations, the engine bay floors, that all needs to be upgrades, and just painting of the building. So we continue to strive to make those improvements. Mental health is a problem in the fire service, or actually emergency services altogether for fire and police. Suicide has been on the uprise for police officers and firefighters over the years. We want to continue to do what we can to train our personnel to be aware of that and provide them the resources available. We have in-house people that can talk to them. As you know, we have a good assistance program, employee assistance program through HR. and we get people to the right places to make sure we don't run into those problems. But we want to continue to train our personnel so that we can look for those key items and know when somebody's struggling. We want to move on. Years ago, we had a Commission of Fire Accreditation International certification, and our long-term goal is to get that accreditation back too. We focused on the ISO rating because we felt that was better for our community because it helps with some of the insurance rates. So we were able to successfully go from a Class 3 department to a Class 1 department, as you all are aware, but we want to go back to that accreditation. With that, we're finally getting to the point where we're getting the people in the right positions, our vacancies filled, so that we can continually look at the operations and deployment of our department and make sure that that's the best that's in there for future years. And what's happening with some of our upgrades, with the addition to the department within our numbers haven't increased. We're still at 144, but we're moving some responsibilities around and putting people in key places to be able to do some long-term planning, some strategic planning within the fire department, and look at how we're providing those resources. And I'm sure when we get into the question and answer section, all of you have received a study that was done by the International Association of Firefighters. This will allow us to do our in-house study to see where we stand there and what we need to improve. And then the feasibility for the mobile integrated health service, the healthcare service system in the United States is still failing, and we're continuing to want to look at how we can help our population here in the city of Annapolis and increase those services. But that's just one of our long-term goals, and that's going to take some evaluation and figure out how we can do and what we can do with that, even working with the Office of Community Services in the mayor's office and that type of stuff. So with that, we talked about our goals, our benchmarks, and how we do that. These are the benchmarks that are there for firefighter safety. We talked about the cancer initiative, the workers' comp claims. This last couple of years, you can see where we are currently, where that's gone down. Our training hours, the 27,000 in 22, 31 in 23. So the first 8 months of this year look low because it only says 10,000. That has to do because we upgraded our reporting system. Yeah, it's called First Due. So we updated the reporting system. The old reporting system doesn't talk to the new reporting system. So we have stuff in different databases. So those numbers are probably low, and we will be consistent with our 25 to 30,000 hours of training for the year. So I know that's sort of an alarming number. They continue to train. They do required training. They train on a regular basis. It's just a matter of getting everything into that one database, and it's not working very well for us. So we continue to work through that. The other one is the cancer claims. We have 2 active cancer claims in the department currently. And then you can see the accidents, departmental accidents. Now, what should be noted with our departmental accidents, we make our people report everything. If they scratch a fire apparatus from a street sign or a tree, they have to write that, and it's written up as an accident, and we do an investigation on it. So while that may look high to some people, we have to remember that we are still riding around on streets that were made for horse and buggies. We have parking on both sides of the street, and we have very large apparatus that we need to try to get through. And every now and then we sort of tap a mirror, and so a lot of those accidents are that, where they've tapped a mirror on another car and there's no damage, but that gets listed as a departmental accident, and we do an investigation on all those. So I just want to make you aware of why those numbers are the way they are.
That's a reminder to the public to not park on red curbs.
This goes into that safe environment to the community. This is what we provide every day. We talked about our meeting the standards. That's what we're looking at. Well, this is our average. Once our people get on the street, on average, they're on scene within that 4-minute time period. So we are meeting that national standard. On average, we're getting a paramedic on scene within 4 minutes of a call once they go responding. The national average is 8 minutes. We are very proud that we safely get to the scenes and we provide the service to the citizens that we're serving. And then that structure fire assignment, where we're getting people there within 5 minutes, that 17 people within 5 minutes meets the national standard. So this is on average when we get it. We track it monthly. We look at it. We can't meet that first alarm structure fire assignment without our partners, our mutual aid partners. That's important to note, but this is the key notes that we look at, and we are getting there, and we are on scene and meeting the national standards as it comes to response times. And then tracking our complaints and our thank yous. As you can see, there's way more thank yous. This is actually stuff where people reach out and give us stuff in writing that we track there. Here's our ALS staffing. There's our averages. We want 12 per shift. The recruit class that's in now, they're all required to become paramedics if they're not paramedics already, and we continue to meet in stride to get that 12 ALS providers. It's hard. It's hard getting paramedics on to come to work for you because it's a problem throughout the United States, and we're competing with everybody. But I can say that we are close to being fully staffed, and it's just getting the number of paramedics is it. And we've strived the last few years to hire ALS providers to get the paramedics on site. And then this is just some of our public education hours. So just the budget summary. As you can see, there's the proposed projected plans this year. Finance and the fire department are always in constant talks about where they think we're going to end up at the end of the year. We plan on being within budget, obviously. And those are the changes that have gone on throughout the years, and we can explain them as we move farther into it. But I got a couple more slides that'll talk about the changes. This is it. This is the key. This is probably the only thing you need to see about our department. When you saw the budget presentation the other day by finance, I believe it was about 75% of the city's budget goes to personnel cost. The fire department is 92%. Our entire budget is personnel cost. The next part of it is that $1.3 million for contract services. Right off the bat, about $800,000, just under $800,000 goes to fleet maintenance to support, and that's how fleet maintenance is funded. So this is what fire department fleet maintenance costs the city, and it's just under $800,000. So that amount comes right off the bat there for contract services. We only have a $522,000 supply budget. We've been very successful in being able to maintain that. And then our capital outlay this year has some one-time cost in there, and we'll go over that as it in a further slide. But that's the only reason that's up to $200,000. But I think this says it all about our budget. Our budget is fully. It's all about getting fire apparatus and medic units on the street every day, and that's where our focus is. Here are the comparisons from the current budget for the mayor's proposed budget. You'll see a decrease in the salary account and the benefits account as finance went through and did basically an audit and looked at it. We realized that the salaries accounts was funded a little higher than it needed to be. There were some positions in there that were accounted for, that were actually in our budget that were already accounted for. So basically what it means is there were a couple extra positions in there. I was not able to fill those positions because it was not within our 144 personnel allocation. So that's where I believe finance thinks that overage was, and that's going to show some of the costs. Plus some of our vacancies and not being able to fill them right off the bat has probably helped a little bit with that. Our overtime costs are going to, in the proposed budget, there's another $200,000 built into that. That's to maintain that minimum staffing of daily staffing. That's where most of it goes. The main cause of overtime for us is sick leave, FMLA leave, that type of stuff. And it's just because of the numbers we have and having to maintain that 25. Some of the overtime cost goes towards training, but the majority of it is caused just by that minimum staffing requirement that we have. We already talked about why the benefits would be down. So these modest increases here are just basically for inflation, and that's what those costs are. And Danny, the fleet manager, when he did the program budget, looked at it and said we were about $74,000 more is what he was going to need it to maintain our fleet next year, and that's what that increase is. But like I said, that goes strictly towards fleet maintenance and the cost associated with that. So that pays for the mechanics in fleet maintenance. That pays for the fuel and maintenance for parts of the apparatus and all repairs. Rents and leases, there's no change. Some contract services is down just because there was some one-time cost in the current budget that's not in next year's budget. Telephone costs and postage all goes up. What you'll see where it says telephones, and all our apparatus has mobile data terminals, which are basically iPads in the front of it. So what we have to remember is there has to be a cellular service for every piece in there so that they can maintain that. So that's a cost that goes on yearly with that. But while it says telephones, that includes our MDTs. Supplies account is going up $9,000, just under about $10,000. Copy fees are going up. That's all that is. Clothing account is just the cost of inflation there. We've not asked for any major increases. It's just a matter of everything's cost more to maintain. And then the capital outlay, like I said, will be in another slide where you'll be able to see what we're utilizing that for. So here's the highlights that we were going to talk about with capital outlay. There's $140,000 or one-time purchases that are needed for obsolete equipment. The Posi Check machine is a machine that checks our self-contained breathing apparatus. That is the apparatus that supplies breathing air for our firefighters to enter a IDLH, which just means that it's an unsafe environment where they need to bring air with them and breathe air. So this Posi Check machine actually checks our SCBA. It makes sure that it's flowing properly. It's giving our people the right amount of air out of it. It's making sure the seals on their face mask are appropriate and not deteriorated so that they're not going to be sucking in smoke and dangerous gases through that. The Posi Check machine we have is just outdated, cannot be updated. We've used it to its maximized life expectancy, and we have to. This is a safety issue. It goes along with that goal, that #1 fire safety goal, which is the performance standard there. So this goes towards goal #1. It's a safety issue for us. The next one are the video laryngoscopes. They're for advanced airways for our medics to provide people that need advanced airways that are suffering on the scene of an incident. They've requested these $20,000, and it just goes to our #2 goal, which is providing that quality service to the citizens of Annapolis. So these laryngoscopes just need to be replaced. That's there. The portable ventilator, the medics, the EMS actually asked for multiple ventilators. I believe this only funds one. This will fund one on our EMS supervisor's vehicle, just to start to see how it works for us. As you know, we have a lot of healthcare or health assist facilities in the city of Annapolis. We are finding that on some of the facilities that people are on ventilators, and when they have to be transported to the hospital, if we don't have a portable ventilator, our medics have to actually use a bag valve mask, and every 3 to 5 seconds actually have to breathe for that person. So this is a actual ventilator that can be taken to the scene. We take them off of the ventilator in the facility they're in, hook them up to our ventilator, and it maintains their airway till the time we get them to the hospital. So that's what this is, and it goes to goal #2 and the performance standards of providing that quality service to the citizens. In the current budget, you all funded money to do upgrades to the Taylor Avenue gym. So our gym equipment was over 30 years old. We are very thankful for that. This one here is coming out of one-time funds. It's for the health and safety of our people, and this would upgrade the equipment at the Forest Drive station. So this will finish the upgrades to the gym equipment in the stations. It's a one-time cost. They're using one-time funding for this, and it goes towards that firefighter safety goal there, but that's what that $60,000. So that's what the capital outlay increases this year. There's a decrease in the overall contract services budget, and that's because of that EMS audit that was done this year that's not needed throughout. So that was able to decrease that. And I believe we've already talked about the salaries and benefits decrease, and then why you're seeing that. And those projections are done through finance. So if we have any other questions about that, I'm sure they can answer it. Here's the highlights. I think I probably already discussed it, but our overtime costs are due, a lot of it's due to sick leave, family leave, that type of thing, and our minimum staffing. We talked about how we fleet management is budgeted, how they get funding in their budget, and it comes out of everybody's accounts. Police department does it the same way. It's a citywide initiative. They want to show an actual cost of what the fire department is costing the city, and that's how they do it. But the money goes to fleet maintenance, that much money goes toward it. And then the contract services that we talked about there. There's a SAFER grant in this funding. So the SAFER grant is, we did make a request this year to increase staffing by 4 people. We have looked at the way we staff it. And as you've heard multiple times, the healthcare system in the United States is a problem. Hospital wait times is a problem. We've done a lot to improve hospital wait times, but it's still terrible. And unfortunately, if any of you have had to go to the emergency room, you know how long you wait in the emergency room, in the waiting room before you get there. Well, we still have times where people are waiting on our stretchers to get in there because the hospitals don't have any place to put them. So we've reviewed our responses. We know that currently we do maintain a peak time medic unit, but that peak time medic unit comes from the ladder truck or the staffing of the ladder truck at the Eastport Fire Station. I know you've received some from the firefighters that have concerns about that cross staffing. So what happens is, and we will continue, no matter what it is, we'll continue to handle first call first. So if somebody needs a medic unit and we have a medic unit available, they do that peak staffing, they come off of that ladder truck and take the medic unit on call. Our average time at the hospital, so this doesn't include the time on site, but the time at the hospital is right around an hour. It's about 30-some minutes, 38 minutes of the person on the stretcher when it's a good day, and then it takes about 20 minutes for them to finish their report to get out of the hospital. But that's what hurts us, is that the amount of time we spend at the hospital, our medic units aren't available to handle the next call. So the SAFER grant will allow us to stop that cross-staffing of the ladder truck. So the ladder truck is available for other emergency responses and have this peak time medic unit up during those time periods where we know that there's a higher volume of medical calls. It also allows us to send that medic unit to fire scenes to help that NFPA standard of 1710. And that's the standard that some of you have heard about, where it recommends 4 people in an engine company, 4 people in a truck company. We only staff with 3 people currently because that's what our budget allows. So we send multiple units to the scene so that we can get the proper number of personnel on the scene to meet the standard. That's how we do that. This would also allow us to send that medic unit to that scene during the peak times to enhance those firefighting capabilities when they are needed. But this will allow us, in the first step, to stop that cross-staffing. It will help us with that. We were given specific instructions that if we ask for people in this budget, how we think that the city could afford it. We've applied for a SAFER grant. This SAFER grant is a 3-year grant that pays for the cost of the personnel for those 3 years. So it's salaries and benefits and training hours. So it increases over the 3 years. So it's about a $1.3 million request. First year, it would cost us about $443,000 to staff this unit. Second year, we go up to $461,000, and the third year would be $484,000. We believe that this is a good way to get this working, to help us to eliminate that cross-staffing in that truck so that they're available and they're not out of service. But also, we believe we'll see an increase in EMS billing funds, which will help supplement this. So if it works the way we think it's going to work, the unit will probably pay for itself with EMS billing funds. It will probably bring in that $400-some thousand. So we're hoping that it'll be a wash. But until we get it and see that, we won't know. But that's how we believe that EMS billing will definitely offset these 4 personnel, if not cover the whole cost. But until that unit's in service, it's run for about a year, we won't know that for fact. But after the 3rd year, yes, we would be looking for the city to pick up those full-time. They are full-time employees, they're not contractual employees. So they will be coming to work for us as full-time firefighter paramedics. It's just we're looking to staff the unit, and this is the way we think we can do it at minimal cost to the city, and we believe it's going to be a benefit to everybody involved. So that's the request for those 4 people. That's how we plan on paying for it, and we're doing it without asking for a tax increase, without looking to take out of any other part of the city budget. And we do believe that this will probably pay for itself. But like I said, until it happens, we won't know for sure, but we definitely know it will be offset. It'll offset those 4 salaries. So that's the SAFER grant. That's what's the whole gist of the SAFER grant. It's to staff that peak time medic unit, and it's to allow some relief on the medics we have out there. But it's to make sure we have medic units available. And this is a problem throughout. I mean, Anne Arundel County has the same problem. They have a lot more medic units to pull from than we do. This is just, it's a good thing, and it's a good way to make it happen at a very minimal cost. The fleet maintenance account does include money for a fireboat. I know that there's questions. I know that all of you received an email, I believe, from a constituent or two out there asking about the fireboat. We have done a hull survey on the fireboat. We've done an analysis on the fireboat. We've looked at the fireboat. So the fireboat is on a replacement budget just like any other vehicle in the city of Annapolis. Our fire apparatus is on a first line, 7 years, 3 years reserve, and then it's after 10 years, we're looking to move on. So we don't meet that standard. We hold on to them a lot longer. We have an 18-year-old pumper that's still in service at East, no, 19-year-old pumper that's still in service at Eastport. But that's the goal. Our medic units, 5 years first line, 2 years reserve, and we plan on getting rid of them in 7 years. The problem is the cost is increased tremendously. A pumper that we have on order, haven't even gone to engineering yet, that you funded 2 years ago, we haven't had it built yet, came in at $700,000. A year prior to that, it was $525,000. If we buy that pumper today, it's $975,000 and a 3 to 4 year build time. So it's starting to really take effect on our fleet because we can't maintain this process that the fleet managers worked very hard on to get us on a regular schedule to replace our apparatus. A ladder truck, a tiller ladder truck, and we were very successful several years back with the funding that you provided us to get our trucks replaced. They're well over $2 million now. A medic unit is $400,000. Just the last one we ordered was just under $400,000, and it's a 2 year build time. So that fleet replacement, we can't maintain it. So it's becoming a problem. The fireboat is the same way. The fireboat is on a 20-year replacement budget. The fireboat is 18 years old. The fireboat, when we bought it, was $500,000. Anne Arundel County had a boat that was 2 years older than ours. That boat is being replaced now. So our cycle is basically the same cycle there. We talked to the manufacturer of our current boat, and they said that you should get 18 to 20 years out of it. Obviously, with boats, depending on how well they're maintained, you can get farther out of it. I believe in one of the questions from the constituent was that there's some fireboats out there that are 40 years old. Well, those fireboats are basically ships. They are very large vessels. They are maintained by a crew of 5 to 10 people, and it's a different type of boat altogether. But we have done a study on our boat. We've looked at our boat. It's going to take 2 years to get our boat built. There's $1.5 million in there now. We know that we can come in that budget. If we put it off, it's going to be even more expensive. The boat averages about 100 calls a year. It takes a 40 hours minimal to get our boat operators trained.
Could you just
That's at
repeat
the
that? I'm sorry.
very
You
minimum.
have 100 calls a year for the boat?
100 emergency calls a year for the boat, yes.
you.
That's the average. But on the water, emergency calls on the water are totally different than an emergency call on the street here. I can continue to send apparatus and personnel to a scene right down the street here. When you're out on the water, that boat crew of 3 to 4 people are by themselves. They don't have anybody else coming. There are 3 primary boats, emergency boats in Anne Arundel County. 2 of them are owned by Anne Arundel County and 1 of them is owned by us. We work together on a regular basis, daily basis, to provide those services. And it's a needed service. As you all know, we're only a city of 7 square miles, 7.8, whatever it is, square miles, but we have several more miles of shoreline. Very easily, you can just ride through Eastport and see the number of boats that are parked into piers out there. Those boats cost thousands and thousands and thousands of dollars. So when we get a boat fire, well, they're minimal when you get them. Unfortunately, when they're in a marina, you end up with more than 1 boat on fire. They're fiberglass boats. They burn like gasoline. So the need for the fireboat is here. And I think most of you saw it the last time, the big fire at the yacht club, where the fireboat was a tremendous use on the water line there. But yeah, that's where it is. Unfortunately, the boat is becoming not so reliable. I can tell you our fireboat's been out of service for the last 3 months. we are still trying to get it back in order. We definitely want it back in order before the season starts, and the season is starting. Nice weather is here. People are out on boats. They had water rescues that I were listening to yesterday. So it's there. The fleet manager will talk more about the boat when it comes to that budget, because that's where it is. This is not in the fire department budget. This is in the fleet manager's budget. But what I can tell you is that 3 years ago, we put $150,000 into the boat to work on some corrosion and some other things. The motors had to be replaced over the last several years, which was another 100 and some thousand. And the boat is costing anywhere between $40,000 to $50,000 a year just to maintain its service right now. A new boat, fleet maintenance calculates that the yearly cost on that would be between $5,000 to $8,000. So that's a pretty big difference. And with the history of our fire boat, we did not have to put a lot of money into it the first 10 years. I mean, the first 10 years, some of it probably is because of warranties, but the first 10 years or so, the maintenance costs were low. But the older the apparatus gets, the more expensive it is. Obviously, with time, safety concerns are out there and safety enhancements are out there. So updated radar, updated depth finders, updated safety equipment, all that would be on this new boat. So that would enhance our services. So yeah, I felt we need to talk about it because it's in the budget. I know that it's a highlight and it's something that's there, but that's the biggest parts of our budget. That's basically the outline of it, and I'm sure you have a lot of questions, so that's where we are.
Okay, thank you very, very much. As usual, you set the bar on the presentation. I'm going to just go quickly first, because they're pretty direct questions. Why was the ambulance fees reduced to $100,000? Because I thought you said the SAFER would increase those. Or am I wrong?
What's the question?
The ambulance fees, as far as revenue, you reduced by $100,000. Just curious on why.
No, that was not. That was contract services. That was not the ambulance. The ambulance billing fees remain the same, and that's where we're bringing in over the $3 million. So ambulance billing fees did not decrease. The audit was in there. The $30,000 audit was in as part of those fees.
All right, okay, I'll look at that again, okay. As far as.
So I was low on the number I told you. If we would not have done that $30,000 audit, we would have lost $100,000 in EMS billing fees. So we did the audit, and we lost the $30,000 because we had to pay for the audit, but we still had the $70,000. If we would not have done the audit, we wouldn't have got that $100,000. But we did not lose out on anything, and the audit was required by the federal government.
Oh,
But yeah, there is no decrease there. We've actually brought in more money in EMS billing fees this year than we did the previous year.
Okay, and you know what I'm doing is I'm looking at your proposed versus your projected in fiscal year 2024. That's what I'm looking at, is the difference. Your projected for 2024 was 3.5 and your proposed is 3.4. So I had looked at that as $500,000. Was that audit unfunded? Oh, Director Dickinson.
So I think what you're looking at is our revenue estimates for ambulance fees.
Correct.
One, we try to keep those conservative.
Correct.
We have to go through an audit process every year. And the firm that helps us not only with the billing, but the firm that helps us gather our requests for Medicaid reimbursement, we have to pay them out of the proceeds. So that comes off the top. And when we were building the budget and building the revenue estimates, that request for an extra unit was not granted. It wasn't until they put the SAFER grant in that those SAFER expenses are not in the general fund. They're in a grant right now.
Right.
So he's hoping that will make them able to do extra trips, so therefore we'll get more reimbursements, and we'll see that after the year is finished. We get those reimbursements about a year, maybe 9 months after the year ends.
Okay, yeah, and for the public knowledge, that grant is a federal grant for $464.5 thousand. And the other quick question I had was, that audit was not funded, right? It was an unfunded mandate?
That was an unfunded mandate by the feds, and like I said, they told us the audit's required. If you don't do the audit, you're going to lose out on $100,000 worth of EMS billing. So basically, but it was funded, it was not funded by the federal government. But it has to do with that EMS billing fees, but it was funded in our last budget by you all.
And last quick question is, what did you get from the General Assembly this year regarding Delegate Jones's bill? What is that exactly?
So the only thing that I know, and we're very proud of, that was in the budget this year that Delegate Jones and the senator also pushed forward out of the Anne Arundel delegation was a grant or bond grant for the Heroes Memorial at the Eastport Fire Station. Okay. And thanks for bringing that up, because that is pretty important. We should thank the delegation for that. So they want to do a memorial out front. As you drive by the Eastport Fire Station, I'm sure that Alderman Arnett can tell you that you can see where people cut through all the time. So this is they wanted to do a Heroes Memorial, and they've been raising funds between the Eastport Volunteer Fire Company and now professional firefighters have been looking to do that. There's a big sign out front, and the state delegation came through and actually funded $75,000 towards it, so they will be able to do that. There is a request through Public Works to go along with that, and some of you may have heard from the captain at the Eastport Station where they're looking to do a sidewalk down Jefferson Street to go along with it. But the funding that's in there currently, that's the only funding I know that's coming towards the fire department, is that grant for that park out front.
Okay, I must have misread that because I thought there was something in there for cancer screening or thereabouts.
So there was a cancer screening bill in the that went through. I don't know what the outcome was, if that bill actually went through or not. So that one I can't answer.
Okay, colleagues? You had their hand up first.
And I'll be quick. Thank you, Chief. Excellent presentation, filled in a lot of the holes. What's the life expectancy of the used vehicle that you purchased as opposed to a new vehicle?
So the good thing with that used vehicle is that is a special vehicle that's only responds to hazmat responses. So the plan would be is when the rescue squad at the Taylor Avenue station becomes to the point where it needs to be replaced, the rescue squad would move into this special units position and we would get it out of there. So we think we'll be able to utilize that unit for at least another 5 years, and then we'll reevaluate it at that time. But for the use of that and the money that we spent on that, it was a very good purchase, and it helps us well, because that's not a unit that's on the street every day. It's a 50 to 100 call a year type of unit that gets responses. So
Great, thank you. You answered the question on accidents. Cancer cases, is there a deterrent, or is this a hazard of the profession?
I would say, and I will let Chief Lopez add to what he knows, because he's our safety person that we brought on, but cancer in the fire service has become a prevalent problem, and they have identified, because of the hazards of our job and the hazardous atmospheres that we've entered and the carcinogens that are out there, it is a hazard of our job, and we're trying to do things with that. And you all helped us last go around. And Senator Alfred was one of the ones that pushed the foam, but there were foams out there with that PFAS, which was that everlasting chemicals that were in there. Well, those PFAS were actually in our turnout gear. They're still in our turnout gear. The turnout gear that you helped us buy last year, it's encapsulated, so the risk is very small there. But what they found is that the gear we've been wearing over the years actually had cancerous materials in it. And then, while it was cool years ago to come out of a burning building and have soot and all in your helmets and wear that helmet all the time, we found that you can't do that, because that's still got cancerous materials on it. So throughout the years, we've had a cancer initiative. You have helped us fund extractors in the fire stations. We can't afford to give everybody 2 sets of turnout gear, but what we do is you've provided us enough funding that we have spare sets of turnout gear in our logistics office. So if they go to a structure fire today and they are actually inside that hazardous atmosphere, when they get back to the station, their gear goes into this washer and dryer, and that's the easiest way to put it, is the washer and dryer. But it extracts all that out of there, and then we can go to the logistics office and put them in temporary gear until their gear is clean, because it takes a little bit of time to do that. So we continue with our cancer initiatives, but it has been found to be part of the job. Chief, you have anything to add to that?
Good morning. So nationwide, the cancer has become the #1 killer of firefighters around the country. For years, it was cardiac arrests on fires. Now it's become cancer. The steps that the fire department has taken with annual physicals, not being able to have the second set of gear, but having the cleaning extractors of the turnout gear, having a diesel exhaust system, so every time the vehicles are parked in the firehouse, the #1 cancer display from the apparatus is when the vehicle starts to go. All of the diesel comes out. It runs much more efficiently when it's at speed. We have extractors on the side that are attached to the exhaust system, so as the vehicle leaves the fire station, all that's removed and then taken out of the living space. And we have internal policies about not using wearing PPE in the facilities, and then taking time to clean your PPE after a call, take a personal shower and whatnot. So we have policies in place and procedures in place and gear to protect us. But nationwide, only recently did we find out that the gear itself is part of the problem. Unfortunately, the manufacturers, now that they've been called out, have yet to produce gear that does not have that. So we don't have an option nationwide yet.
So I guess my question is, do we have enough equipment? I mean, do the firefighters have to run back to the station, wash their gear, and, get ready for the next call? I mean,
We currently have enough turnout gear in stock to put them in. Now, if we have multiple incidents throughout the day, it may become a problem for us, but currently we're doing okay with that. We continue to look at that, and that's going to be part of, when I talked about that long-term planning, looking at the way we're providing services, the number of people we have on it, and all as one of those goals. We're finally getting to the point where we're getting people in the right positions to be able to do that long-term planning. I've been feeling for several years that, and most of you know, my tenure as fire chief has been pretty challenging. I mean, it started off, we lost a firefighter to cancer. First thing that had to happen to me is we lost a lieutenant to cancer, and then COVID hit. So we feel like we've been maintaining. We've been here every day throughout all that, but I do feel like we can't really do a lot of planning because that's it. We're just making the daily stuff, and we're getting people in positions now that we can look at all this stuff. It's been your support, though. The entire council has helped us with this cancer initiative. The station extractors for the turnout gear, the exhaust system is in the station. Now, we've also gotten some grants for some of that stuff, but what we couldn't get grants for, you all have helped us with that. You continue to, and we'll continue to bring it to you because firefighter safety is our #1 concern. But currently, we feel like we're doing okay.
Okay, well, keep us aware if there is a need,
We
please.
appreciate that.
DPW, are you on their schedule for the renovations of the stations?
Yes.
I mean, is that a CIP project or?
It's part of CIP projects, and it's
Okay.
also part of it's on the CIP project, and then the amount of funding that's given out yearly to maintain the building. So it's done through those two different funds.
Okay, but it's going to be current, not sometime down the road, 2 or 3 year project, I'm hoping.
Don't bank on that.
That's something we have to ask for, I guess.
Well, that's a question for him also.
Yeah.
For DPW director.
Yeah.
I'll go on to the next question. Chief, how are you recruiting? Is there a program that will encourage young people to go into the fire service?
So our recruitment process is done through in-house recruiters. That's a collateral duty for them. We try to get out there to the community to try to recruit younger people out of high school, but with our initiatives to hire paramedics already over the last couple of years, that hampers that initiative because we're looking for people that are already trained. So this most current go around, we actually opened it up to anybody that didn't have certifications, and this current process is like that, but it all comes to what we're trying to do at the time. And we continue to get out there. We're getting out there more, but what I can say is that we're fully staffed, and if we're not fully staffed, we're getting ready to put those other 4 people in the academy. So we don't have that recruitment problem that the police department has. We're continuing to get people, but it's hard. It's hard to get people. Even our counterparts in the large jurisdictions who were getting 20 and 30,000 people to put in for jobs aren't seeing that. And so we continue to try, but I don't know if some of it's a generational thing or some of it is just but we do. We get out there, we're trying to do it. We're looking at other initiatives to try to bring on some people, and we're always looking at city residents to see if any of them are interested and get them on the list.
I know I'm coming up on or over my 5-minute allocated time, but I'm going to be quick. Ventilators, I know you have one in the budget, then that the firefighters have requested more. Let us know if more is needed. Seems pretty difficult to have one ventilator.
So we will. We manage now. My thought was, in talking to the senior staff, is if we get the one through the budget, we'll see how it works out, and then we'll evaluate how many more we actually need. I don't know that every medic unit needs a ventilator on it. But the way we plan on doing this with the EMS supervisor, we will get it to those scenes and as we go. So this is another program that we want to see how it works before we dive right into it.
How did you survive during COVID?
So our medics have to actually do where they have a bag valve mask, and every 3 to 5 seconds they are breathing for our victims. So that's what it is. If I could add, I see in the crowd now is the president of the International Association of Firefighters, Local 1926, President Joe Pilot. He did point out to us that the cancer initiative you talked about was funded through the House and the Senate. I think they don't know how they're going to do that now, but they have money set aside for screening for firefighters, and they're going to work through and figure out how they're going to do it. They don't know how the funding's going to come out, but the state did put some funding aside for cancer screening, and I appreciate him pointing it out to us.
Well, and this is not fire related, but Madam Chair, we should hear from our lobbyists, because we should be made abreast. We do have a lobbying firm, I understand, that has been hired to lobby for us, even though they didn't get our agenda. But somebody needs to let us know what was lobbied for on our behalf, and successfully or not. We should just
reading it in the paper.
Exactly,
Right, that's where I found out.
Chief, I'm glad hospital wait time is improving, and you seem to have a strategy for dealing with that. Safer Grant, we did that several years ago, did we not? And I think we got 5 firefighters out of, if I remember correctly.
So for those of you that have been here for some time can remember when the bottom fell out of the economy, and we actually lost positions in the fire service, not citywide, and we were struggling. And through the use of the Safer Grant, we've gotten back to basically the allocation that we had to staff the equipment. So we have used the Safer Grant in the past. We've been very successful in getting it. We are hoping, this is just 4 positions, we're hoping to get it this go around and try to eliminate some of that cross-staffing and to help us with our medical.
Do you need a demonstration of support from the council as far as the budget is concerned? Or is it just an awareness for us that you put it in? Do we have to fund any positions so that it's like give and get,
So we have to maintain our current staffing levels. We can't have vacancies. And in your proposed budget, that's what we need from you, is to make sure we continue to have the proposed staffing that's in the budget, and that helps us with getting the grant. Yes.
Okay, great. Thank you. And I'm glad you mentioned the fireboat, but we'll talk about that later. I see Ms. Dickinson has her hand up.
Director Dickinson?
Yes, I wanted to clarify, and Chief can correct me if I'm wrong. The Safer Grant provides funding for these positions. Then over the course of time, we have to absorb those costs. The Safer Grant will cut back. So within a few years, we'll be paying for these ourselves. I just want you to know that going into this, but we're including it in this budget. Hopefully we can get them and find a way to keep it staffed.
Thank you, Chief, and your staff. Very informative.
Yeah,
When's the next cookout? I've been missing the hamburgers. I mean,
Sheeny, you'll have to tell us.
thank you.
Yeah,
Sure.
so that SAFER is really a springboard for staff. So I'm just chair license here to expand on healthcare. What is the state grant for, it's for defib, don't make me say it, a defib, MIEMSS, what is that?
The MIMS grant? That's a yearly grant that we get from MIMS. MIMS is our certifying agency for our medical personnel.
medical company or
And
something? What is it?
that's the state, it's a state grant. It comes through the state to them, and then MIMS gives it out. And that grant there is just used for AEDs.
There's two of them, there's a 50/50 and
So the only reason I asked is if there was any opportunity that a
So
ventilator could
we
come from
apply for
as
that, but
well.
that's a statewide grant. They just came out and said, hey, we still have some money left, and let people put in for it, and we just got like $1,000 towards an AED. So that grant, we get some money from that grant every year, and they also provide us a training grant for our medical providers where they'll give us a 50/50 match on some of our training programs. So any grants that are out there, we do go after. It's
Oh, I know.
unlike
know.
a lot of other grant opportunities out there. There's not a lot out there for the fire service, but if we can capitalize on them, we do. But that's a grant that we do receive something every year. There's the Senator Amos grant, that's 508 funding that comes in every year,
Yeah,
which is a account of money that we continue to get. But it's small grants that are done
Yeah,
through the
They
state.
reduced it this
Yes.
year. Okay. Alderwoman O'Neill.
Thank you very much. I have one quick question. In your staffing summary, it's 144. Are the 4 SAFER grant in addition to that or included in that?
So they would be in addition to that if we get it. The only way this peak time unit goes in service and we stop the cross staffing is if we get the SAFER grant. There are not 4 positions funded in the mayor's proposed budget. The only way that this program would go is if we get the grant.
Okay. And for this year, you said that you had pretty low, not very many positions open. How many positions are filled of that 144 currently?
Currently, we have 3 openings.
3 openings?
the admin.
Yeah, well, so we're processing currently, we just had some people go out on medical disability, so we will have a couple more, but currently there's only 3 openings. One of those is an office associate, one's a fire inspector who has moved on and went to do an inspection somewhere else, and one's a firefighter. We will have 2 additional firefighter openings, but we have a fire school starting in June, and they will all be filled. So all those positions will be filled over the next month and a half.
Okay. And my last thing is not a question, but it's a suggestion. I think that the fire department needs to do a big PSA about what drivers need to do when they see a fire truck with lights on. In the past 3 days,
It's crazy.
3 times I've pulled over and people have either continued to pass me or honk at me for stopping. So I think that we need to create a PSA to remind drivers of what the rules of the road are.
We can definitely look at that. The state actually has a move over law for when you're actually on the highways where you have to move over. They've done a lot of PSAs on that part too, and as much as we throw out there, people continue to drive the way they drive.
Yeah, I'm happy to share that in my social media if you guys create something.
Yeah.
We can take a look at that.
And joint with the police, because they don't move over for police cars either.
Correct.
Yeah.
A little more
Absolutely.
regularly than fire, but still.
Yep.
Right. That's all my questions. Thank you.
That's it? We can get Alderman Arnett's questions in if they're quick. Okay, good. Good. Go ahead.
Thank you very quickly, and thank you for the highlights. Can I get a copy of the Medicaid audit? It is interest to me because that's where I spent most of my professional career, but also I want to see the audit to bring it to the audit committee so we can see the kind of audits we're getting.
So that's the question for me. I'm going to have to work with the company that arranged the audit to see if it's something that can be relayed publicly, or don't remember there being any findings. They go through and see how we calculated things, and they correct them if they thought we were we thought they were wrong, and then they fix our numbers accordingly. But I'll be glad to see what we can get
Yeah,
to
I
you.
appreciate it, although I don't consider myself a member of the public. I consider myself a member of the
Well, I think it's, yeah, I don't know what the
So-
state organization that does the audits would consider.
On the fees, I understand what the EMS fee is, but what is the ESPP adjusted fee?
So that's sort of the funding that you were just talking about. So now, it just occurred over the last 3 years probably. We have the normal EMS billing funding fees that are put out. But once a year, we are able to submit actual cost through Medicaid, and then they reevaluate it, and that's where that other $1 million comes from. So it's all part of EMS billing, but it's it's at the end of the year that we get to do, and our EMS billing company works with us to provide that to the state. Last year, we got a lot less than we probably were due, but they had changed. The first year we got more money than we thought we were going to. So the second year they looked at it, and I think they reevaluated, took a look at the actual cost, but we've turned around and provided all the information that's go around and done very successful with that. But it's all part of that. It's a one-time cost, one time at the end of the year where you can actually bill for your actual cost.
That's kind of part of the reason why I want to see the audit. Being the guy at the other end at CMS, I want to see what they're doing to us. So I'd like to find that out. There's 2 new programs here in addition to ISO. The Commission on Fire Accreditation International Certification, which I don't really know anything about. And then so I'd like more information on that, and particularly how does it differ from ISO? But then also what sounds like a new initiative, the Mobile Integrative Health Program. Be interesting to know more. It sounds like it's home health visits, but trying to figure out how that fits into our mission from the city.
So I'll start with the last one, that mobile integrated health. If you look over the last couple budgets, that's been in there. We have not made any success with that. We started out doing some alternate transportation facilities and some what we call treat and release, but treating people on the scene and not transporting them to the hospital. We had an agreement with MedStar, which is out on Jennifer Road, that low priority people could be taken there instead of the hospitals. It had to be approved by the state. None of that has worked out. There's programs throughout the U.S. that medic units have either coupled with some healthcare facilities or mental health facilities and gone to those people that we frequently call 911 that don't necessarily need that. So it's a way to look to see if that program would be beneficial in Annapolis. It's not a request to start a new program. It's just that's one of our long-term goals, to look into it, to see what the needs are there and how to do it. That accreditation is just that. It's a national accreditation for fire services. We held it probably 15 years ago. Where we were accredited through that agency. It's just a different accreditation process. But the ISO is done through the insurance rating company or organization, and that helps with insurance rates. So it's a totally different. They don't intermingle. They do look at that under the international accreditation, but it's just a different accreditation.
So is the accreditation like CLIA?
It's like CLIA. That would be a good way to put it. It's like CLIA. It's done by an international
Maybe
firm.
one more, Alderman Arnett, and then we can go to Rhonda.
Right. So where do the fire marshals show up in the staffing summary? Are they in there, or are they credited to planning and zoning?
So they are in our staffing summary, but the only ones you see in there are the 2 civilian inspectors, the office associate, and the fire protection engineer. The uniform people that are in there are just combined within the lieutenants and the captains and the number of captains overall in there. But there's 5 people in code enforcement. There's a captain, a lieutenant, 2 inspectors, 2 civilian inspectors, a civilian fire protection engineer, and then the 6th would be the office associate.
And where are the bomb dogs?
So the bomb dogs they're tied in just under the overall staffing of the firefighters and lieutenants. They fall within that staffing level you see on the chart. But there's supposed to be 1 supervisor on day work and then 4 investigators. There's 1 investigator for each shift.
So
we have 1 in the police academy currently.
So it's 5 for marshals, 5 for bombs.
So yes.
All right.
If,
I have more questions, but I assume we can submit them in writing.
Yes, yes. I'll do them in Pendle. Charles, a couple minutes.
Thank you, Madam Chair. Two quick questions. Number one, what company provides your unbiased training? And number two, why aren't manufacturers changing the way that they do business when it comes to equipment?
so the unconscious bias training is being done by Anne Arundel Community College.
Okay.
So it's being done through them. We are paying the college to come in. It's
I heard
basically
good
this.
things from the police department about
It's
that.
the same instructors and the same program that was given to the police department.
Right.
As for the manufacturers out there, they can, I don't know if it's a workforce issue, like our medic unit. We had a medic unit on order, and we were told, well, if you had a chassis, because it was a chassis issue, you could get it in the build program quicker. We got a chassis, and it was still a 2-year build time. So,
Oh, I'm talking about what the firefighters wear.
with the
Their gear.
turnout gear,
The
that's
turnout gear.
that they're working on it. The problem is if they take those materials out of there, the vapor barriers won't be as good, so the firefighters aren't as safe when it comes to the heat and the moisture. So it's that they're trying to mix to figure out where that proper initiative is there for the turnout gear. So they are actively looking at it, but it's slow moving and finding the material that's out there. And this PFAS material that's used appears to be the best for them currently. But unfortunately, if it off gases, it creates the issues.
Okay. Thank you. Thanks so much for everything.
All right, thank you so much. And just for clarification, you will be getting some written questions that please send them to me, and I will ensure that the respective department head gets them. And then you respond directly to me, and we'll document and get it out, just to keep document control of those, because there'll probably be a lot of questions. Thank you for, as usual, you set the bar for these presentations. I live at Park Place, and I hear that siren constantly, knowing that you're out serving the public. So thank you very much for your presentation and your work. And we have our tradition.
All right,
Go ahead. Alderwoman O'Neill will do the honor. She went shopping for us.
While she's doing that, if I could real quick, I know everybody's seen the audit that was done by the International. We are taking a deep dive and looking at that audit. I can tell you as fire chief, I want to have 4 people on all suppression equipment. It's just how we can do that where it's financially and fiscally responsible to everybody. So currently, the way we meet the standard is we send so many people to the scene, but that's a goal of our fire union, and we are going to continue to look at that. So it's out there. But hey, thank you.
So you throw that.
This one may hurt as much as the as these,
Not
but
to
we
belittle it,
appreciate
but you
the
can throw
gifts.
those at the cars that are in your way. I don't mean to. All right, thank you all. All right, we're going to take a quick restroom break if we need it or anything, and we'll try to, we're going to be about a couple minutes late. I know the Parks and Recs is timely. We'll do a change of the guard here. What's that? are,
So nobody else added it for them. It's
listening. Can at least, organize them and be reasonable, like 10 or less questions. I'll get them to the department head. The department head responds to me, and then we will then put it on a document that will be shared with my colleagues. Does that sound good? Okay.
for the public, was that for everybody? If not, you have this,
It's perfect, just for us, really.
okay, no,
She said it to her colleague.
okay.
Okay, we're
No,
good.
Julie, we're ready.
We are ready.
Okay,
Is
we're
Ju-
live.
We're live. Okay. Was that all live? Okay. Oh, great. Okay. Hi, thanks for being prompt. We'll try to make up on the time for you. Help yourself to granola bars and introduce yourselves and who is at the table or anyone in the audience you'd like to name, and you can begin.
Thank you. For the record, good morning. Rosalind Johnson, Director of Recreation and Parks for the City of Annapolis.
Lakeisha Simmons, Recreation Division Chief, City of Annapolis.
Rodney Dillard, Recreation and Facilities Division Chief, City of Annapolis.
And I do want to recognize our amazing staff sitting behind me. If they could stand, please. This is the management team that pulled together all of our accomplishments and supported the 40,000 residents of Annapolis this past year. And they, and anyone can challenge me on this one, are the best recreation and parks team in the entire country. And I've seen a lot, and that's who they are.
Yeah. I knew you were going to do that. That's why I gave you.
Thank you.
Thanks. Great.
Our vision statement is, our purpose is to enhance the lives and wellness of all residents, visitors, and communities. Our mission statement is to enrich the quality of life by providing recreational, educational, and wellness programs in facilities, parks, and waterways, and to expose youth and adults to as many introductory recreational opportunities as possible so that they can determine their interests. Currently, we have one exempt staff person, 24 civil service, 6 contract, in this proposed budget, and 31 total employees. We manage more than 200 acres of park lands, trails, and playgrounds throughout the city of Annapolis. And it's important to note that these 200 acres belong to the residents and visitors of Annapolis, so they're all property owners. We manage 43 parks throughout the city, 8 facilities. We continue to experience an increase in park usership, and our staff really, and this is, of course, we operate differently than police and fire, but our staff really are first responders in the services that we provide. Of course, we protect our park lands for the residents, and we serve the residents and visitors here in the city of Annapolis, but we really can help save lives, whether we're redirecting negative behaviors into positive behaviors, or we're extending your life by having you take a walk in one of our many beautiful parks, thus reducing your blood pressure and increasing your mental health and all the positive things surrounding mental health. We offer traditional recreation programs as well as special events such as our Girls Play Initiative, Trunk or Treat, Easter Egg Hunt for Youth, Teen Night, Community Fun Day, Autism Acceptance Day, and our Black History Month event. Here is our organizational chart. There have been no changes since the previous year we presented. We had a lot of highlights. One of our major ones was we updated our registration software to allow online registration for memberships, fitness classes, summer camp, licensed daycare, and events virtually. No longer do you have to come to PIP to purchase tickets or register for a program. No longer do you have to arrive at 5:30 in the morning and stand outside in line for 30 minutes until we open up at 6 for our licensed childcare. You can do that all online. I would like to say, though, part of our goal is to also help remove barriers. So this year you will still be able to stand in line outside of PIP if you wish. We will not open the registration up until 6 a.m. So you can register from home or in person. And so we're taking steps until we will fully go completely virtually. We've implemented a new greeting station at the front entrance of PIP. The memberships at PIP increased from 7,200 to over 9,000 in FY23. In 2023, the pool sold 133 memberships, and we had over 28,000 pool experiences from paid patrons, 39 birthday parties, 128 participants in public swim lessons, and our busiest day during the swim season was Sunday. We worked collaboratively with the Penguin swim team to ink an agreement where they will practice during morning hours, thus freeing up the pool for our community in the evening. And during the summer of 2023, we hosted 1,832 campers in safe, fun learning environments. We hosted the first Parkwide Community Fun Day. Residents and visitors enjoyed all of the activities available free of charge, especially the pool. We hosted the first statewide 2S LGBTQIA+ summit in the country. We held our first trunk or treat, which was met with overwhelming excitement and acceptance, allowing participants of varying abilities to enjoy all of the activities, including the pumpkin patch, free of charge. For Greenscape, there were 69 projects completed with the help of 350 amazing volunteers in city parks and 6 right-of-ways. Thanks to a $60,000 grant from the Cal Ripken Senior Foundation, we will open 2 STEAM centers. They're technically STEM, but we added the arts. And those centers are both at Stanton and Pitt Moyer. They will open later this month, early next month, and staff has already undergone training to teach the various components on the equipment that we've received. We will introduce hydrospin and aqua trampoline, as well as more learn to swim classes. And we have focused on staff training, and so hydrospin and aqua trampoline is something that we brought back from one of the conferences we attended. We offer free admission to the pool during heat advisory and poor air quality days. We produced and distributed our summer program guide, the earliest date ever, which was February 6, 2024, 2 days later than Anne Arundel County Recreation and Parks, but we'll beat them next year. Let's see, we held our first all-staff training, including active shooter, 2S LGBTQIA+, and ADA. Staff attended Athletic Business, NRPA, which is National Recreation and Parks Association Conference, Maryland Recreation and Parks Association Conference, Senior and Cultural Arts Summits as well. We held our Girls Play, which again is a product of our staff attending conference, which stands for Positivity, Leadership, Ambition, BU initiative, hosting over 117 participants of all ages that filled Pitt Moyer. And the girls received instruction in sports such as tennis, gymnastics, basketball, soccer, volleyball, lacrosse, and rock climbing. And the goal of the event was to expand opportunities for girls in sports and ensure that girls have equal access to recreational opportunities in our communities. We installed a new and quieter full basketball court at Annapolis Walk with better access. Acquired and cleaned up the Moore property for Carr's Elktonia Beach. We partnered with the Resilience Authority on the RFPs for shoreline and coastal restoration and a completely new park master plan for Carr's Elktonia Beach. I do want to underscore that we have a blank slate of paper for Carr's Elktonia, and so we are looking for public input to decide what that park will look like. We installed a new fence and soccer goal at Primrose Park. We refreshed the engineered wood fiber surface at 4 playgrounds, Bates, Newman Street, Chambers Park, and Bywaters Park, painted the walls and dividers for all meeting rooms at PIP, maintained licensing at latchkey sites. We revamped our training for part-time staff to ensure that they get paid for the training that the department will now provide. We purchased 5 major pieces of equipment for the department, a 30-foot motorized lift, robotic field lining machine, again, a product of what we brought back from a conference. Alderwoman Tierney, did you want to say something?
Oh, no, I was just, you caught my ears on the equipment, but keep going.
Oh, okay. A Kubota Bobcat, Kubota 72-inch deck motor, and a Kubota 3400 field tractor. We began renovation of the Dick Callahan outdoor basketball courts, and that will be completed in time for our June basketball tournament. Working and installing the half court at Adams Park, working with the consultant on the feasibility study of the courts at Parole Elementary, completed the first of 3 applications for Phragmites removal at the creek at Truxton Park, and we're working with the contractor on that. Held first quarterly teen night for over 150 teens, providing transportation from area housing communities. And this free event included a 3-point shooting contest, pickleball, volleyball, and esports tournament, paint and smoothies, reusable bag designing, and music. And the food was courtesy of our park maintenance team. They had hamburgers, cheeseburgers, turkey burgers, veggie burgers, chicken cheesesteaks, complete with onions and green peppers. It was really a smorgasbord of food. No one left hungry. We also are one of the few in the country where USTA Tennis Ambassador site, where they're going to assist us in doing a study on our tennis and pickleball site. And then we introduced our new department mascot, Ollie the Osprey. So our goals for FY25, we want to begin to and substantially complete a citywide recreation and parks master plan. We want to begin the Commission on Accredited Park and Recreation Agencies accreditation through the National Recreation and Parks Association. We want to increase safe water access at all city waterfront parks, create an official therapeutic recreation program, and this speaks to the Recreation Leader 2, because we do not have any expertise as far as inclusion and making sure that everyone can access our programs. We have general expertise, but for example, I thought it was Autism Awareness Month and it's Autism Acceptance Month. So it's important for us to make sure that we do have a professional who can modify our programs and make sure that everyone is welcome. Complete and design the design for the Science, Technology, Engineering, Environment, Arts, Agriculture, and Math program at Stanton. Increase our Learn 2 programming for teens, adults, and seniors. Build the city's first universally accessible playground at Newman Street. Continue to increase accessibility to all communities by implementing free youth sports clinics. Audit our permit process to make changes to ensure equitable access to facilities. Create programming to enable under-resourced youth in the city of Annapolis to learn to swim and be water safe. For example, this summer, our fitness and aquatics manager, Jennifer Rafiq, has added many more Learn to Swim programs, 8 sessions for $48. And again, we still offer scholarships. Seek out and obtain available grant opportunities for our programs and facilities. Ensure that we invest in our staff by providing appropriate training opportunities to include supporting staff in becoming CPRP certified. The person to my right and the person to my left are getting ready to take a class so that they can become certified. Work with the community to create a plan to develop Carr's Elktonia Beach utilizing the federal grant. Increase trash collection by 1 day at 6 of our busiest parks, and restore and update signs throughout all of our parks as needed, and replace the grills at all 3 pavilions. These are our performance measures, and this is a baseline. And you'll notice the increased emphasis on health because our staff are also healthcare professionals. I think that was one of the takeaways from the conference we attended this past week. We want to look at the percent of residents selecting good or excellent when rating overall quality of parks and recreation opportunities, and the additional staff will assist us with those opportunities. Satisfaction with programming, percent of respondents that rate their experience as excellent or good. Parks and Recreation class program facility registrants per 1,000 population. Percent of registrants that are city residents. Percent of housing units that are within a 15-minute walk of a park or open space. And National Community Survey, percent of respondents selecting good or excellent when rating quality of city parks, number of hours of training per staff for Latchkey, and number of hours of training per staff all other. Our long-term goals are to develop educational programs hosted within recreation and parks facilities. And this is key because with the advent of artificial intelligence, we're going to have a certain segment of our population that will be unemployable because they possess the soft skills that are being replaced by robots. So it's imperative that we help people learn about science, technology, engineering, arts, and math in a friendlier environment than some of your kind of standard school settings. So I think we're going to be the linchpin to help bridge that gap for the community. Continue to provide diverse program offerings and activities. Begin to provide environmental education programs. Renovate by creating a multi-purpose lighted artificial turf field at Weens Wayland. Begin to measure and reduce the Rec and Parks carbon footprint. We've already started that with the ability to register remotely or virtually. Create a dog park in the city of Annapolis. Create a kayak share at multiple sites. Become CAPRA certified organization. Create a staffing pattern reflective of the level of service expected by residents in facilities and parks. Increase professional level certifications by 25% throughout the department. Complete trail restoration at Truxton Park. Design and build a new park maintenance facility. design and complete the renovation at Stanton Community Center, and complete the shoreline and coastal restoration, park master plan, and visitor center at Carr's Elktonia Beach. Here is our budget department view from FY22 to FY25, and you'll note that there are modest increases in some of the various categories to help us be able to continue our programming that we have started to implement. And next, our proposed fee changes. We looked at our fees, and we've been asked to look at our fees to see where we are compared to other jurisdictions. I would like to note we did change from our initial submission. Annapolis Walk, we changed that and dialed that back to $75 an hour for residents and $90 an hour for non-residents. But we have implemented a security deposit at many of our locations. We found, particularly with our pavilions, we have no amplified music, and many of the renters would have amplified music, and there's nothing we can do. And it's like, okay, you had amplified music, the police showed up multiple times, see you later, have a great day. Or people are putting non-painter's tape on our walls and pulling off the paint and all sorts of things. So providing they rent and the facility looks the same as when they first got there, they'll get 100% of their security deposit back. But it's something that we don't feel the taxpayers should have to bear the burden for private rentals. Budget changes from FY24. We have additional funding for splash camps, which are our pop-up camps, funding for facility repairs and improvements, funding for cooking classes and food for events at Stanton Community Center. We were really disheartened to learn that Chris and our staff at Stanton were actually purchasing food out of their own pocket. Funding for additional programs at Pip Moyer, funding for cultural performances, funding for part-time staff at Stanton Community Center. For the last 3 years, they were running at a deficit. We are also going to work with finance to figure out a way that we can capture our rentals. The more rentals we have, the more our part-time staff increases. So it's an artificial inflation of our staffing because we're bringing more money into the city revenue funds, but we're expending more money in order to be able to do that. Funding for additional positions, a park maintenance worker 1. We've had more duties put on our park maintenance staff over the years, and the staffing has not changed. We traditionally had let our part-time staff go right before Thanksgiving, and our part-time staff return every single year, but we have plenty of work for them to do, and it's the worst time of the year to let staff who've worked hard all summer go, particularly when we have additional work for them to continue to do. Our recreation leader 1 at Pip Moyer, we're missing an opportunity where we could actually be running programs. We have the space, we have the materials, we should be running programs for the community such as arts programs, jewelry classes, homeschool programs during the day, toddler programs during the day, because we have the equipment and supplies. And then again, that recreation leader 2 is a certified therapeutic recreation specialist, someone who can help modify our programs and our summer camps for inclusion, as well as for seniors, senior aerobics, and all sorts of things, so that we can really start the program for all of the city of Annapolis and not just those people who don't have special needs. And that's our presentation.
And
Any questions?
Who is Osprey the Owl? Is that a secret who that is?
So Ollie the Osprey. Ollie the Osprey has many personalities.
Okay.
So depending on the day and depending on the size of Ollie's belly, we will have different people in playing the role of Ollie.
I'll start with 3 hopefully quick questions.
Sure.
You mentioned a park maintenance facility. I didn't see that in the capital budget. Am I missing something, or what is that?
So that was in last year's capital budget.
Okay.
There was, I believe, $1 million for that. So we haven't started working with Public Works to start to plan that, but we're looking at a Butler building, some type of prefab building. The facility that they're currently in is a trailer that I'm not sure why. We've been renting it for years. We've paid for it multiple times over, and it's in disrepair.
Okay. General question, when you evaluate fees, what are you looking to capture with those fees? Would it be safe to say that the additional staff was looked at as well and addressing that in your fee revenue?
Yes. Yes, the additional staff, the quality of the service we're going to provide. We looked at other jurisdictions to look at how much their rental fees are and where we are. For example, at Annapolis Walk, we feel we should provide a staff person there during the rental to assist the renter. And so we looked at the cost of providing that staff person. But yes, we did look at all of those pieces, as well as whether or not people, when they rent for an hour or two, are they there 2.5 hours to 3 hours? Are we missing recouping that money as well?
Okay. Third and last question.
Oh, and the renovations that we're doing, thank you, Rodney, at Annapolis Walk, for example, as well as at Pitt Moyer. We started painting, we painted the rooms at Pitt Moyer. We're getting ready to redo the floor at Pitt Moyer. We're getting ready to redo the lighting. And then we have chairs, Chiavari chairs that people can utilize or pay extra for, $3 a piece at PIP. And so we'll be able to recoup the cost for those Chiavari chairs within a short period of time. But that will kind of give them a higher level event if that's what they're looking for, or they could still have the same type of event that they've had with our regular chairs.
How often do you evaluate the fee coming in? Is that a quarterly review on your part, or do you wait till the end of the year to see what you've recovered?
We wait till the end of the year.
Okay. The last question I have is, and this is for the public to know, is I heard the list of equipment that you added. Does that change what defines park maintenance? There's this thought that your park maintenance includes kind of heavy duty stuff like trimming back the trees, right? I mean, yeah. Rodney knows this very well. So could you define what park maintenance entails and what kind of equipment you use to do such a thing?
Sure, I'll turn that over to Rodney. Before he starts, I will talk about our field lining robot. For example, it would take 2 gentlemen or 2 women, but in our case, we have 2 men who would line the fields. It would take them 3 to 4 hours. Right now, our field lining machine can line an entire field with 1 staff person in about 30 minutes. And then we have also saved on paint because it's consistent paint. When you have a person spraying paint, it's not consistent as consistent as a robot is. Rodney?
Rodney Dillard, Recreation Parks. So the equipment that we purchased, for one, we haven't purchased equipment for the facility for Recreation Parks in over. I mean, I'm talking about power equipment.
Oh, your mic.
Large power equipment we haven't purchased in years, over like 10 years. We're way overdue to catch up with our competitors, the Anne Arundel counties, the Prince George County. So we purchased a field machine. Is a 3,400 Kubota tractor. It helps us groom the fields, the infield, and it has several different features. You can mow with it. You can pull stuff with it. Is a high-powered tractor that we desperately needed. We had an old John Deere. I'm gonna say the John Deere was a 78. This is the first time we ever had a 2022, 2024. So we're excited about it. We have a Bobcat, which we normally will have to borrow from Public Works. And if they're using it or doing something, we have to wait. And sometimes waiting, we can't honor a request that comes in from our works, comes in from you guys. We have to do it manually, and that puts a lot of strain on the guys, and it takes more people to do that. So we wind up getting a Bobcat, and that's going to allow us to do our trail maintenance and everything we have to do on the trails, because we have to revamp the trails restore the trails at Truston Park. We bought a new a Kubota mower, in which the guy is really happy because he's been in that mower for I don't know how long. His name is Pat. And we do have a wide variety of ground to cover in a week. So we have 200 and so acres of land to cut. And our big tractors are the ones that do it. So it's a 72-inch Kubota tractor, and it's allowing them guys to, make the schedule, meet the deadlines, And then we have a field robot, which Director Roslin just spoke about. This robot is very expensive, but it saves us a lot of time in the week because the robot takes 20 minutes opposed to one guy doing it for 3 hours, 4 hours doing the lining. It takes them 20 minutes to do the same thing. So it brings us up to speed because we're moving into the time that we're living in now, but we was outdated for a long time.
That's really great news. Where is this equipment in the budget? Is it capital outlay or supply? Where do you have it in your
So
budget?
we partner with Public Works. Public Works bought majority of our equipment
Okay.
throughout the fleet maintenance
Okay. That's where it is.
department.
Okay. Yeah.
And I think Donovan did make a request in the budget for our facility. So I don't know if it didn't come in ours, but I think it's in his budget as an increase for our new facility.
And I'd like to give Mr. Dillard and Ms. Simmons, along with Chief Simmons of OEM, a shout out. They presented at our statewide conference on how to turn a recreation center into an emergency shelter, and it was, and they did a phenomenal job, and it was met with great excitement and optimism. And other people, I think, can learn from what is happening here in the city of Annapolis.
Yeah, what was the incident, refresh my memory, the incident that was necessary that you opened up?
Lighthouse, when there was a fire at the lighthouse, as well as our heating shelter that we provide at Stanton.
Okay. And what was the award you just gave Michael Malinoff?
So this past year, I was president of Maryland Recreation and Parks Association. And so as part of being president, I get to give presidential awards. And so my boss, Mr. Michael Malinoff, supported me in being Recreation and Parks president this past year, as well as the mayor. So that was a thank you for supporting me in that position and in role, as well as in my role here.
Thank you.
Thank you.
Questions, colleagues? Alderwoman Finlayson?
Thank you. Thank you for your presentation and for clarifying a lot of information that we needed. I'm focusing on the fees because that's of greatest concern to me. Just, and the one, of course, that got my attention initially was the Annapolis Walk. And the proposed increase goes from $30 to $75. But looking down the list, almost all of them have significant increases. And I would like to hear a little bit about how you came to these fees. I know that you make comparisons to other jurisdictions, but we really aren't like other jurisdictions. Annapolis Walk is in the middle of a community that needs that center. The whole idea about putting it there when the development was created was to give the community a resource. And so my concern is that we want to out cost them where it's not affordable. The center has not been maintained over the years. And we have had one young woman who comes to unlock, makes it available to whomever is renting it, and then she comes back at the end of the night and she locks up. There is no oversight, there's no management, and there are problems, minor problems, however, because I live there and I haven't seen major problems. But it seems like we are putting the burden on those who rent. And any number of people rent it. It's a very busy place because it's the only place. And so I would like to hear a little bit about how you derive at these significant increases, kind of across the board. From 20% to 150% over previous fees.
Thank you for your question. So we looked at other jurisdictions, and when I say other jurisdictions, like Quiet Waters, for example, the rental of the facility there, we looked at the pavilion rental at Quiet Waters. We took into consideration that people, when they're renting the pavilion at Quiet Waters, the renter can either pay for a blank purchase for parking, or each individual person can pay for parking. We looked at our cost as well, and we looked at kind of the market value, and we looked at the size and number of people that would be able to fit into a particular facility. And based on that information, it's our professional opinion that the fees were not where they should be. Of course, we were asked to look at market value and what those fees are. Now, you all as council can certainly say, this is a burden for the community. We want it to be this rate. We don't have that authority, but that's our professional opinion as far as what it is. I don't know if Lakeisha Lakeisha wanted to ask any more, add any more information about how we came up with it.
Lakeisha Simmons, Recreation Division Chief. We also looked at, because like you said, it has not been maintained, but we are in the process of doing major renovations there and improvements to the facility, especially at Annapolis Walk, including the guys are there painting. We're looking at redoing the floors there, as well as upgrading the bathroom features.
Well, and I appreciate that. Does that mean that then it will be monitored after the work is done? And so the person who now is assigned to opening and closing either will have a larger responsibility or there'll be somebody else responsible for oversight.
You're absolutely correct. We should have a monitor, facility monitor there during all rentals in case someone gets locked out, in case there's a mop in the bathroom that shouldn't be there, in case there's a spill that needs to be cleaned up. That should be our responsibility. We shouldn't just be turning over a city facility to a group of people and saying, have at it, we'll be back in 2 or 3 more hours. That's really not the best way to do business and provide excellent customer service.
Well, thank you. This is a starting point, and as you said, you have a responsibility, and we do too, to make sure that our residents have accessibility to our facilities. So,
Absolutely.
I had another question about Williams-Whalen. The last we heard, the timeline was something like 2025. Have we changed that? We were talking to Director Vogel, I think, about moving that timeline up. That is the only field that the city of Annapolis has. And for it to be offline has been a hazard, a hindrance to our local teams. But to say that it's going to be another year, 2 years out isn't acceptable. So where are we with Williams-Whalen? Or maybe...
So it's unfortunate, it's been, I think, has it been 12 years?
About 12.
About 12 years it's been out that the public hasn't had an opportunity to use it. I do know that the soil testing has been completed. Director Vogel and I kind of disagree on cost. So, I hope I'm right and he's wrong, because I think it'll be a little bit lower than his estimates. So once we get those cost estimates in for where we would be, I think we will have a better idea of how long it will be. The soil testing, I've received the report, but we need some help interpreting it as well. Rodney has just recently received the report. So depending on what those results are from the soil testing, whether or not we have to have 6 inches or 12 inches, whether or not the artificial turf field will, instead of, us needing 6 inches, we need 2 inches because of the artificial turf field. We're also looking at not doing crumb rubber because of the environmental impacts and concerns. And we're looking at possibly doing a Brock, which is a naturally treated wood process for the infill, which is much better for the environment. We've been in conversations with the comptroller because in order to use program open space, she's requesting certain things. So there are a lot of moving parts for that. But I think once we look at the soil testing and once we have a decision for where we're gonna go, of course, our professional opinion is to have an artificial turf field, because as you mentioned, it's the only turf field that the city owns. That's rectangular, and so that will give us much more playability. It's in an area that floods often, so with the artificial turf field, we could just keep going. You could have a huge storm, and within 90 minutes, it'll be drained and we can still play. Whereas if it's a grass field, 90 minutes, we would not be able to play. We're looking at a couple of days, and that would really kind of change the availability to the public. So, and balancing that with the cost versus, we're going to have to wait an additional year before we could afford an artificial turf field. So all those things will be decisions that people higher than me will have to make.
Well, and I was going to call on Mr. Malinoff, this is a person higher than you, to help the 2 directors to come to some decision about what it's going to cost so that we can move on this, as opposed to having further discussions. We need to make some decisions and move on. If you can help the directors get to that point, that would be great.
I shall.
Thank you. My last question, you no longer need a front desk person?
No, we do have a front desk person.
Because there's no line, no money allocated in the budget proposal that you have.
Yes, so Budget Director Dickinson has consolidated the front desk with PIP's budget. We've asked for it to be pulled out. I think they're going to be able to pull it out again. I think we've gone through iterations and we're coming back full circle where the front desk budget will be pulled out from PIP. So there will be a line item which will help Melissa Brown be able to better track her budget, and it'll also help Bumper Moyer be able to better track his budget as well. So I think we're pretty close, but I don't want to speak for Director Dickinson.
So, Ms. Dickinson, are we going to see a new budget with that amount pulled out, please?
So when you say you don't see it pulled out, what are you referring
I'm
to?
looking in the presentation.
Uh-huh. Which page?
There's not numbered, but the page that Finance Department Budget Review, 2225, there it is. Front desk, 0.
It's in facilities.
It's moved up to Pip Moyer.
It's grouped in with Pip Moyer.
So could you pull that out so that we could, the department could see the allocation for that expense?
We're working on splitting the accounts that we have in our accounting system so they can see each account separately. So then they would be able to show you these amounts separately.
So is that a yes that?
It's a yes, but I don't know at what point in time you're requesting it for. Is this something the Finance Committee wants, or is this something that you're
I asked why
asking?
there was no money allocated for front desk on the screen.
Okay.
And the answer was that you had lumped it with the facility cost.
Yes.
Am I correct, Ms.
Yes.
Johnson?
Yes, you are.
So I'd like to see that number pulled out, because I think the department indicated they could better monitor how they spend and use those funds in that position if they
Correct.
know the funding. So we shouldn't be just lumping things together, I don't think, but can we do that?
We are working on a way to separate the accounts so they can see them separately.
I mean, it was separate before, wasn't it?
Yes, it was.
Okay.
It was in a separate org with, it was a very small amount sitting out by itself. So we decided to consolidate it with Pip Moyer to make it easier from what we're doing, because it only had a couple of employees and a supplies budget. We're working on it now so that we can separate out those accounts within the Pip Moyer org so they can see everything separately.
Okay, thank you. I see Ms. Conley over here.
You good?
She says she's good. Okay, so we'll see that broken out with the facilities broken down with all of the costs. Thank you.
Thank you.
Alderman O'Neill, do you have any questions?
Thank you. I have a couple. Thanks very much. Mine are also just about staffing. On the staff summary, I see that there's not anything listed under camps and classes for seasonal staff, but I think that you said you were adding camps.
Yes, we're adding additional camps. Camps and classes are part-time seasonal, and so it costs us, my numbers are running together now after all the numbers work, but it costs us about between $2,500 and $3,000 in staffing and supplies per camp. So that's the additional funding, but we bring in more than that, so we make more money than the city puts out for our summer camps because they operate at a positive.
Okay. So that will just remain 0 because we don't exactly know how many staff are. I'm looking at the staffing summary that's in our budget book.
Oh, okay.
It talks about the number of positions for FY24 and 25, but I don't see a seasonal staff for either of those under that line item, camps and classes.
Budget Manager Katie Conley. I do see where you're looking, and we'll double check. If you look at the line item detail, though, you will see a line for seasonal staffing for this division.
Okay, yeah, I mean, it's just blank right now. Thank you. And then I was questioning the funding for cultural events, additional programs, and you talked about food for events. Can you talk about the events that
Sure, I think for ease, they got lumped together as events. For example, our Black History Month event, our Asian Pacific Islander Month, the Hispanic Heritage Month, and different monthly activities that we've been doing, along with our holiday jazz festival, our Easter egg hunt. All of those kind of got grouped together as cultural events, but those are special events where we try to recognize as many people in the community as possible. So that's what that is.
Okay.
So it's not just we're going to buy food, but a lot of those events, we do provide food. For example, our teen nights, for example, the cooking class at Stanton, the Halloween event, their holiday event, all those sorts of things will have the funding for it. So it's not just food. That was, I think, one of the things that stuck out to some people because of the anecdote that we shared about our staff actually paying for that.
Okay. And where is that on this? What category are those items on?
So that's, some of that's in Stanton Center. Some of that funding is at Stanton Center. Some of that funding is at PIP. And some of that funding is also in Canson classes, actually. So it's kind of spread throughout. So that's where those pieces come from. There was also a question about performers as well. I know with the performers, those are like our DJ, the jazz band that we had come out. It's just lumped together in just one kind of big category, food and performers and cultural arts activities, I believe.
Okay. And are those all activities that then become self-funded if we're putting up the money? Are we charging for those activities, or is it just an expense?
So it depends. Some of the activities, for example, our Sweetheart Dance, we have been charging. We did hear back from many of the participants that the rate we were charging was too high. I tend to agree with them, and I think Lakeisha does too, Ms. Simmons does too. So we're looking at kind of offsetting that a little bit and probably going down to $5 instead of the $20. And then our public events, such as the Easter egg hunt and those other types of outdoor events, they're free of charge. So I think, this is a benefit that we're providing to the community. So I don't think those events will charge, but our classes and our camps and things that you have to register for, we will. The adult Easter egg hunt, we charge for that. So I think it will depend on the event and depend on the impact.
Okay. And from finance, could we just get a breakdown of, for instance, Stanton Center, what the staffing cost is versus programming or food?
Mm-hmm.
Thank you. That's all the questions I have.
You're welcome. Thank you.
I'm sorry, I forgot my second column, 4, 5, and 6, the Latchkey program. Thank you for that, as always. What are the hours?
Lakeisha Simmons, the hours for our Latchkey is, we have one site that does morning care, and that is from 7 a.m. until the start of school, the first bell. And then aftercare is from dismissal until 6 p.m. Okay. And so if it's a 2-hour early dismissal, it's from whenever school dismisses until 6 p.m.
And training involves making sure they're, what does training involve for the?
Training is mandatory classes that they have to have and so many clock hours that they have to have per year and per school year.
And you do background checks and all that?
Yes, ma'am. Okay. Yes, absolutely.
And you include food supplies for them, or snacks?
We do provide snacks for some of our locations, for 2 of our locations, because they are non-Title I schools, and so we do provide the snacks for those 2 locations. Okay. The other locations, the school provides the snacks for those.
So you're happy what's in the budget then to cover all that?
Yes, ma'am.
Okay.
Thank you.
The security guard, who's that for? 20,000?
The security guard is at the pool.
Oh, for the pool. Okay. Yeah. And last but not least, everyone's favorite subject, sorry to be AIPPC. I think it might need a separate conversation with the Director of Finance. I don't understand the numbers there at all because I don't understand. My understanding is that their revenue is coming from the state allocation of hotel tax, correct? And so it goes through us, and so we report it, right? Help me out here.
Yeah, so I'm not sure where those negative amounts came from there.
Yeah.
If they're looking at what we're spending, we're giving them the spending authority to spend their occupancy tax revenue that they're being allocated,
Right.
and to spend anything that's we anticipate will be left over at year end. And maybe Katie can clarify where those numbers are coming from.
And perhaps we shouldn't have put the brackets there. We just put the brackets there to indicate that it's a pass-through. So we don't touch that money. They allocate, they spend. We will process the payments on their behalf, but that is AIPCC's
So
money.
talk about that a little bit. What kind of oversight do you give them? You process their payments? What else? I mean, it's in Parks and Recs for a reason, I assume.
It is, yes. Myself or my designee are an ex officio member of the Arts and Public Places Commission. So I've been on the meetings. I don't have a vote, though, and we kind of listen in and see what they're spending on. They are impressive with the way they determine what they're going to support, what they're not going to support. They do try to spread the wealth and not fully support activities, artists, and events 100%. They try to have the partner bring money to the table as well. And they really do try to spread the wealth and not just fund one group versus another group.
Is the objective there to try to put artwork in the public, within these 200 acres? Is that the objective, is to?
So it's not just for us. So they do the summer concerts that are all over the city. They do curate the artwork at Pip Moyer. They do murals throughout the county. They're doing one in Parole. They're doing the one at the basketball courts at Pip Moyer, the Callahan basketball court. So it's all over the city. It's not just on Recreation and Parks property.
Thank you for going to those meetings.
Sure.
So is this the amount? Is this the accurate amount that they get?
That's correct. Traditionally it's a projection because as Director Dickinson will share that those are estimates for the hotel occupancy tax. They've been pretty spot on. Usually it's a little bit more conservative, and so at the end they will have additional funding, but their funding rolls over from year to year. So they do have it, and that's their spending authority that the city gives them. And usually it's a little bit higher when it's all said and done.
Did you have something to add? Are you sure?
Just to say, we wanted to clarify, those are the amounts they're being allocated for spending. It's just you have to take the brackets off. That is their spending authority.
And again, it's a pass-through, for lack of a better word.
Yes, it's passed through. And we don't have the amounts up there for the actuals for 22 and 23 because there was spending in 22 and 23 as well.
Okay. Colleagues? I don't know who was first. I think it was Alderman Arnett. Okay.
Real quickly, first of all, thank you so much, Director Johnson. Very impressive report today.
Thank
Really
you.
appreciate it. And also thank you for following up with the Adams Park, the Parole School, and and doing the things at Chambers Park. Really do appreciate that. 2 questions. What are our 6 biggest parks?
So,
Rodney, oh.
He knows them. He listed them yesterday when we were putting our budget together.
so I'm trying to get where you going at.
I heard Director Johnson mention something about our 6 biggest
Okay, the
parks.
additional it's not the biggest parks, it's the busiest parks.
The business.
And so,
Okay, busiest.
So one of the busiest is Acton's Landing.
Okay.
Tucker Street is essentially a busy park. Amos Garrett is definitely a busy park. Annapolis Walk is definitely a busy park, and Chambers Park is definitely a busy park. So what we want to do is increase our trash collection on those parks because they're so busy and the trash accumulate really, really fast there. We normally do a two-day trash collection day, Mondays and Fridays, but what we want to do is Monday, Wednesday, and Friday, hit the busiest parks in the city. I think it's one more that's listed in there. Well, trust we there, so we do Trusted almost every day. Like we can see that, but just getting out of Trusted is our focus. And those are the parks that what we really get calls in because of the trash, the overflow of trash and things like that. So what we want to do is focus in on them this year and create another schedule to provide a better service for the community.
All right. The other last question, Director Johnson indicated there's been an increase in park usership. How do you measure, say, Chambers Park when there's no entrance, no exit fee or any monitoring? Is there some way you can figure out how many people are using it?
Excellent question. So during COVID, Google used to track people with their cell phones, and we had over a 389% increase in park usership. It's done by county, though, in Anne Arundel County. So Anne Arundel County had the highest in the state the last time that they did it. Because COVID is over, they stopped doing it. So we don't have the measurements, but anecdotally, asking our staff, are you removing the same amount of trash? Are you seeing the same amount of people that are in the parks? And that's one thing on a national level that we've noticed too. Once people are connected with parks and they're connected with specific parks, they don't lose that connection. They still keep going. So I think during COVID, we were one of the few places that were open other than hospitals, gas stations, and grocery stores. And so people, started their patterns, and it takes 21 days to create a habit, and so those habits are created and they haven't changed.
Okay, fine, thank you. And thank you to your wonderful staff back there.
They are pretty amazing.
I think you have a new person, the gentleman sitting next to Mr. Chucky.
Yes, that's Mr. Wesley Wood. He is our acting marketing coordinator, and he is the person who actually got our program guide out sooner, and I'm talking months sooner. We used to, our summer program guide used to come out in May, but parents have already made their decision for summer camp and for summer in many instances by May. So kudos to Mr. Wood for figuring out where the phone was and being able to get our program guide out in time.
Thank you so much, everybody.
And Alderwoman, we are trying to update our technology so we can quantify the numbers for the city of Annapolis to be able to know the active users of our parks. So we're working on that too.
Okay, thank you so much, everybody.
Thank you.
Thank you.
Thank you.
Thank you, Madam Chair. Like Alderwoman Finlayson, I'm having a little bit of trouble reconciling the staffing chart. In the budget book, we show 168 positions up from 165. But I think the real permanent staff, if I'm counting it correctly, are at least those that are associated with a grade, is 26 positions. And then if I add contract staff, as you're reporting here in this, that would be 6 more, which adds to 32, but you're reporting 31. So I can't quite figure out where the difference is.
So it may be that one of our contract employees, but I think we double checked the contract number. There's a contract employee that's going to be converted to a civil service, position. So I don't know what you're looking at. I don't have a copy of that in front of me.
Okay, well, I guess it's probably more for finance to get that clarified. I don't think it's a big issue. What I do see in here is for parks, it looks like there's 10 staff. And then your other your volunteer positions. And, but it also lists a horticulturalist. And I'm wondering, is that the same as Brian Adams? Or is that a different horticulturalist?
No, our horticulturalist, Brian Adams is an arborist, is my understanding. And so our horticulturalist is Melissa Whittinger. And so Melissa's our horticulturalist. And she's certified. She's also a certified arborist too, but.
Okay, but is that a
part-time?
It's a temporary position? Is it a contract
No.
position?
Her position's part-time.
Good question. I'm in the budget book, it's on page 9.
Her position should say seasonal.
Right. So I think there's, just trying to get a fix on the staff. I mean, obviously you're using quite a few more people than you actually have on your staff, which is a good thing. I'm in favor of that, but I'm just trying to reconcile the numbers in the chart as reported on the budget. So we don't have to carry that on in the interest of time any further.
21.
I'm looking at the performance measures, and I understand this is a work in progress, and we had a very good report on this at the audit committee this morning. But I'm looking at a lot of empty boxes here. So we have the reporting that came from the survey, the National Community Survey, but then there's a lot of good titles here: satisfaction with programming, a percent of housing within 15-minute walk, but there's no data there. Is that because it's a work in progress and there'll be in future years more information here?
Short answer is yes. It's also very new. We had our retreat, as you know, we had a wonderful retreat. And so this 10-minute walk or 15-minute walk came out of that retreat. And then we had a retreat about 2 weeks ago where we started kind of putting how we're going to get there and our steps towards it. So we haven't gotten our baseline yet to determine how many households are there. So we're starting, but this is at the beginning
Good to hear.
stage.
Thank you. First of all, I appreciate, and I especially was excited when we did the thing at the beach and getting the Moore House. I mean, we're doing a lot of really great things, and you're a big part of that. So I appreciate you and your staff. But anyway, moving on, I see on your long-term goals, the very last one about the shoreline at the Cars Beach, but we're also having a lot of erosion of other waterfront. I don't know whether how that interleaves between you and Public Works, but I just got another email this week after all the rain about more shoreline erosion, and I want to bring it to the attention of the council that this is certainly a growing issue for us, and I appreciate the work you're doing there. Speaking of shorelines, have we tracked down the current in the water at Truxton Park yet?
So that is with the harbor master and assistant city manager Jackie Gile. Okay. But they do have a contractor on board. The contractor is assessing it. Depending on what they find, the contractor will be able to abate whatever the challenge is within that contract. But again, it's depending on what they find. If it's something extreme, they won't be able to do it within the contract. But we're closer now than we've ever been before because they are a marine contractor and they do this type of work all around the country.
Two more quick questions. Is our leaf blower legislation affecting you for your operations?
I didn't hear.
We moved from gas to electric.
Gas to electric.
It doesn't go into play until December.
Nah, I think the guys like gas, but we know.
We're moving to electric. I didn't know whether you had paid attention to what we did here and whether that's going to affect your acquisition for equipment and moving to electric.
So it will, but I don't believe that goes into effect just yet. Is it December 31st?
Yeah, right.
Okay. So we haven't started planning. We will start July 1st planning on that with this incoming budget.
Just wanted to remind you what we're doing.
Thank you.
Thank you.
And the last one, I like the trash collection, but I think a more generic question, and I get it all the time, is trash cans on city streets. And I don't know whether this is Public Works, but it really would help keep our streets clean if we have more trash cans available on the street. Unfortunately, it'll probably be used for doggy waste most, but nevertheless, more trash cans. But thank you for a very thorough report. I appreciate it.
Thank you.
I appreciate your efforts at Parks and Recs.
Thank you, Alderman Arnett. Just to expand on that, on the shoreline, that was really great news on Truxton. You have a contract for the removal of the
Phragmites?
Yeah.
Yes,
Yeah,
they're suggesting 3 applications. So the first application's already been complete, and then 2 more, which will be this fiscal year and then into next, I believe.
Thank you so much. And then also, it was music to my ears to hear you say, and to also, to Alderman Arnett's point, you said that we're adding staff, I forgot what the context was, to meet the performance measures. I mean, that's what we want to hear, right? I forgot
Absolutely.
exactly what you said, but thank you for that, that framework of thinking, is what do we need to meet the performance measures? And then there's less defense that you have to do to the committee. This is what we need to meet the performance measures, and, why haven't you? But again, to Alderman Arnett's point, we need to finish them. And but thank you for thinking that way.
Absolutely. And I do want to give one more quick shout out to our staff at Stanton Center. We have the after school program there, and we rely heavily on our volunteers. We have some amazing volunteers there. Our staff goes to pick up the participants, and this program is free of charge, but our staff go to pick up the participants to bring them to Stanton. There's a child who is in the 5th grade who is unable to read, but the staff and the volunteers there have been working with this particular child, and they are starting to read. So, reading is fundamental. If you don't get it in elementary school, you're not going to get it, but these are the types of changes that our team, our staff, and our volunteers are making.
That's excellent. Yeah, if you can't read by 2nd grade. Not to harp on the Latchkey program, but do you know where most of the kids come from?
Yes.
What areas they come from, the Latchkey program?
So they come from the area schools. So we have Mills Parole, West Annapolis Elementary, Annapolis Elementary, Hillsmere, and Germantown.
Okay. That's just great. That's excellent. Yeah.
And of those 5 locations, we do accept the child care vouchers, and 22 of our families in those schools receive the vouchers.
It's just it's just such a it's such a huge deal because it allows the parent to work, pay rent, and then it has a safe environment for the child. So I can't thank you enough for having that. Alderwoman Finlayson, closing remarks?
Well, but thank you, Madam Chair. The Latchkey program has been with us for a while, and you're enhancing it, and that's awesome. I had a quick question about, you mentioned you start at 7 in the morning and you end when the school day begins for the first shift, for lack of a better description. Mm-hmm. Does that time change? Do all the schools start at the same time now?
Yes, since they did the revamp of the school start times, all the schools start at the same time. And what we found is we don't have it at the other schools because the parents we had no one that registered for those programs. And because the school starts later, the parents can get the kids there. But the one school does have 10 participants that they still need that before care.
Mm-hmm. Okay, well, thank you. And you should give the closing remarks for the.
I didn't want to keep.
You guys do awesome work,
Yeah.
and it's needed. Most people don't see recreation as a vital part of our lives, and it is.
Stand up, everybody, and introduce yourself. Come to the table. Come to the table on mic and introduce yourself. You sat through all this, and we want the public to see you.
It might be good to add up all the years these folks have doing this.
Good morning, everyone. I'm Melissa Brown. I'm the Front Desk Member Services Supervisor.
All right.
Good morning. My name is Christopher Beck. I'm the Stanton Community Center Manager.
Good morning. My name's Jennifer Rafiq, and I'm the Aquatics and Fitness Supervisor.
Good morning, Council. Andrew Patterson, Recreation and Parks. I'm the Recreation Sports Supervisor.
Good morning. Wesley Wood, Acting Marketing Coordinator.
Good morning, Harold Chucky Lord, Recreation Leader 2.
And last but not least.
Hello, everybody. Bumper Moyer, Facility Supervisor at the PMRC.
Thank you so much. Alderman Pendleton.
Thank you, Madam Chair. Director Johnson, it probably would be good to add up the number of years that all these folks have been in their profession. I think that would be really impressive.
Absolutely. I would say we're at hundreds. And they look very young.
All right. Well, thank you.
Thank you.
Again, we have a tradition here that we give you a little memento for your efforts, and very appropriate.
Thank you.
Thank you so much.
Thank you.
Thank you. And I'll forward any questions that I get from my colleagues that haven't been answered. Oh, wow, she really did get a lot. She's given all up to the staff.
Well, that's good.
Yeah. So before we break for lunch, City Manager, and I didn't confer with my colleagues on this, but I'm looking to
We have
find.
somebody coming.
Could we add central services? I'm looking at Tuesday of next week. We have Public Works in the morning. He might, no? Oh. And then we have Human Resource. I can't find any other place. It would be then after lunch, right?
That would be fun. What's the date on it?
The 23rd. Oh, okay, so we're going to take a lunch break. Julian?
Wait a minute, we have planning and zoning here.
Oh, what's he doing here? Sorry, we were gabbing. Sorry about that. We're a little bit over, but that's fine. Thank you, Director Jakubiec, for showing up so promptly. So without further ado, when you are ready, completely ready, you can start. Introduce yourself, introduce who's at the table, anyone else you'd like to introduce. It's all your show.
Okay, thank you. Good morning, or good afternoon, everybody. My name is Chris Jakubiec. I'm the Planning and Zoning Director. And with me here is Maria Brown, the longest-serving employee of the city of Annapolis ever in the history of Annapolis. Not at all. She is one of the youngest people in our office, I must say.
Consistent.
And she's been here since 1975.
Wow.
Yeah. And her nickname is Indispensable.
Thank you.
And she is that to me. So thanks, Maria, for being here. Maria heads up the operations in our department, so she's involved in assisting me with the budget. Certainly is involved in managing our finances and check cashing and paying vendors and the like. So she has a unique set of skills to bring to this discussion. So we're the Department of Planning and Zoning, and as you know, we have a lot of responsibilities within the city, including code compliance, land use, mobility, enforcement, property maintenance. We also, as you know, administer federal grants, local programs like the housing programs, the city's housing trust fund. We administer tree planting and tree maintenance programs, inspect street trees. We also actually do inspections of sidewalks as of this year. So the next snowstorm that comes around would have inspectors from the City Department of Planning and Zoning out there. And the last part of this slide here shows that we're involved in many of the codes or titles of chapters of the city's code, from harbors and waterfront areas, subdivisions, planning and zoning, to the adequate public facilities. We're involved as the principal or lead agency in administering those local laws. Our staff provides support to a number of citizen and official boards and committees, including the Planning Commission most prominently, but also the Affordable Housing and Community Equity Commission and the Heritage Commission. This slide was meant to graphically show what we do in a very quick way. This is our work. The size of the font or the details of the text don't necessarily indicate the amount of work given in any category, but we just try to get them all on this page. There are a lot of other things I think we do, but we're very busy and we have a full portfolio of projects and project types, from small area plans, flood damage assessments. We write grants, do forest conservation and adequate public facilities. We deal with all construction in the waterways, like piers, docks, marinas. And of course, there's the enforcement and the licensing of rentals and short-term rentals that we're involved in. We have a number of divisions in our department. You may have not recognized the division called Director's Office, and not so much a division as just a way of showing you what it is that I do and who reports directly to me. Of course, all the division heads report to me, but also there's the assistant to the director, which is Maria, a humble title for what she actually does in our office. She's really the director of operations and planning and zoning. Our zoning enforcement officer and the environmentalist, who is actually Brian Adams, who's dealing with trees, and I'm moving him from the current planning division into more of a direct line with me so that I can track his work. We can focus on meeting the city's canopy goals. And also his work is just a small subset of the current planning division. It's just not a very good fit. But we can talk about that. It's more management planning strategy that's not pertinent really to this discussion. But we have a current planning division, and there's our set of staff there. We have a principal of design who's actually retiring and whose last effective day in the office will be April 24th. But his official date of retirement is June 30th.
Tom?
We have 2 senior planners in that position. We have 2 planner positions, which is an entry-level position, and those positions are vacant now. We have a contract planner, and she's been a godsend. She used to work in this department full-time and has helped us manage with a very light office staffing. We have an administrative office assistant assigned to that division. The permits and inspections division is our most staff-heavy division. We have a chief, John Manassa, an architectural plans reviewer, a permits administrator, which is a position that I'd like to discuss more with you later, if time permits. Building and site inspectors. Our building inspectors have, up until recently, done just that, building inspections, but we've broadened their capabilities to do site inspections too, so they track the compliance of planning commission approval. So they're going out to the sites to make sure that builders are building according to the plans that were approved. So it's an added responsibility for those 3 inspectors. We have a senior property maintenance inspector, which is and then 2 other property maintenance inspectors. These are the folks that go out to inspect HACA properties, go out and inspect and follow up on code compliance issues, fences that might be torn down, and yards in disrepair and junk and things like that. And then we have an associate and an administrative office assistant as well. On the right-hand side of this, you'll see economic development, community development, comprehensive planning, and historic preservation. Each of these are considered divisions, but you can see they're very light in terms of staff. In fact, our historic preservation division is really just the chief. The administrative office associate is managed by Maria. She actually manages all the associates, administrative staff. But so we have those very important parts of our service, but they're not staffed particularly heavy. So next slide. On the 24 highlights, I began in September, so I don't have a whole list of highlights to report. The obvious things that you're aware of is the comprehensive plan getting accomplished, and there's the waterfront action plan, which provides waterfront access, and there's a newsletter that we're publishing now. There's a lot of other things that we're doing, but the ones I wanted to highlight were operational changes. We've elevated the permits administrator to a higher profile within our office, and we're hopeful that the classification study will in fact agree with us that she is deserving of a pay scale that matches the role she plays in our department and the role I need her to play. But that's beyond what we as staff can do. We're certainly advocating for that change with the HR department. Weekly expedited project approvals. So we essentially have a same-day service. Every week, we're processing applicants the same day. Usually, we're able to do 4 or 5 of those. We do as many as we can get, up to 5. So sometimes we might only get 1 or 2 of these small projects. But if we can get 5 applicants in, we'll get 5 applicants out that week. We have a dynamic building permits review. That means it's not...
I'm sorry, was that day or week, the 5? What did you say?
Oh, a day. We do them a day, but each week we do 5, but we'll do them same day service.
Thank you.
And we would do more, but typically we don't get many of the small projects, as it turns out, that we can actually do in a fast way. We do what I call dynamic building plans review, rather than waiting for an applicant to submit a project, and when they submit it, we put it on the top of the stack and we work away from the bottom, and it takes a while for that thing to get down. Each day we open up work items and we see what we can do. If there's something we can do fast, we'll do it right then and there, rather than creating longer time for getting approvals. And that is very important when someone simply is asking for approval of a revision that the staff requested. We don't want that requested revision to sit there for a month while we're doing other things. So we go right to that revision, make the change. Thank you for making the revision. you got it in the same day. Enhanced procedures for rental housing licensing. This is of particular importance with respect to HACA properties, but they apply throughout the city. We give 180-day notice now before a license is set to expire to give people adequate time to get into the process, give us more time to do the inspections, give the licensee more times to comply with the inspection results and get the property up and running or get the property into compliance before the license expires. That's just one part. We also notify folks when we're going to condemn a property ahead of time. Assign staff to ongoing customer service. Maria, could you discuss about this item, please?
We have received, I would say, about 5 commendation letters from the public in the last 2 weeks for several members of our administrative staff for their assistance with our new online permit system that is not necessarily user-friendly, and especially if you're new to it, it's not really user-friendly. So our staff has done, they not only answer questions on the telephone, they may spend the whole entire phone call with the customer from beginning to end of whatever process they're trying to do on the system. And we have customers coming in and using our computer at work. We have a computer station, and they will come in, and our staff will go out there and spend 45 minutes to an hour and a half walking them through so that whatever it is they're trying to get done, they get it done. So the letters of commendation are telling us that it's helpful and it's appreciated, because, for people to take the time and write those means how much they appreciate it. So that's our way of going that extra mile in customer service.
In the months and year ahead, we want to get more systematic about that by actually asking for feedback, but we'll get there. The next slide begins a discussion of the performance measures. I've showed performance measures for each of the divisions in the office, and this slide shows the 2 that pertain to inspections and permits. And the key measures here are really timeliness of action, percent of applicants reviews initiated within 3 days, and the second one is the percent of reported alleged code violations investigated within 3 days. And you can see we're in full compliance with that. The staff is pretty efficient, and John Manassa runs a tight shop in terms of getting inspectors out to do that. I will say that this is an important goal. Achieving this goal, however, means that we don't always provide the best explanation for concerns that we might have or the best service. And in the years ahead, I'm actually going to think about whether this goal is achievable with our current staff, because we need sometimes to spend more time documenting issues and writing letters and explaining to property managers what issues we found, to be more of a service to community. I mean, we can always do this, achieve 100%, but it doesn't mean we're treating these very human problems appropriately. So I just want to put an asterisk on this. We'd like to return to this and maybe propose a different way of capturing efficiency that captures the bigger part of what we do. Comprehensive planning, the performance measures there dealt with ensuring our zoning code requirements are easy to understand. I think we've not done very well in this particular performance measure, if I could be candid. The number of videos posted, there were 12 that were identified, and these videos were meant to explain the code. None were actually done. In terms of the clarifying zoning amendments, there have been zoning amendments done. These have been generally initiated by the city council. We've not been proactive in explaining and helping the council simplify the code, and we're the ones most affected by the complexity of the code. So it's in our interest to help resolve the complexities of the code and make them easier to understand. You see here, I put a little sofa at the bottom of this plan. That's just sort of an indication that that's an area for room for improvement. And so when you see those sofas, you think about a room, but also think that links us to our budget request. In this case, there's a personnel enhancement. And I wanted to link the enhancement to the standard or the performance measure. In this case, we need to build our capacity. We have really essentially a comprehensive planning division of one person assisted by a young planner. We don't have the capacity to manage the zoning text amendments at all. We're always behind, and I've had to, in many cases, just say, we can't do it. We can't meet the schedule to get our eyes on code and get them back to the council. Not to mention actually writing the changes that we really believe are necessary. So that is a request to hire a senior planner position who would work principally within this comprehensive planning area on code and design, but also assist our current planning division to work throughout the office in a kind of an interdivisional type of way. But principally, this request, this room for improvement, is a request for you to fund that personnel enhancement, a senior planner. This is the historic preservation performance standards. One of the measures is the percent of public hearing applications approved each month. That is a benchmark of 90%, and we've exceeded that to 100%. 100% of violations resolved or referred to the Office of Law within 90 days. We're at 100% on that as well. And a number of links added to the HPC webpage. That's the landing page for the Historic Preservation Commission. We've done about half of that so far this year. Room for improvement. There used to be an assistant to the historic preservation chief. It had long been a position in the planning department, but for some reason, I think it was when Mr. Tower was elevated to chief, his position wasn't backfilled. I think that's what I understand is the reason. But we're asking for a part-time person. That position was always part-time. That would allow us actually to look at the historic preservation and cultural preservation parts of the city that extend beyond the historic district, that are just citywide of importance. The Hoppy Adams project is actually a relevant proposal that would allow us to further that, but also gives us a chance to participate with property owners, answer their questions in a informed way, and get our staff reports to HPC in plenty of time for the public to review them in advance of a meeting and give the members time to review that. So we just need more capacity within this particular division like the city used to have. So this is kind of a repair request to get us back to where things used to be. So that would be a part-time position as an assistant to the historic preservation chief. And
before you continue, I just don't want to lose sight of this. I really want to ask management that what the director is doing here should be memorialized for all departments once we have performance measures complete. I think this is excellent. This is so right. He has performance measures, and then he's saying where do we need room for improvement to meet those performance measures, and then that equates to whether it's added staff or what have you. So I'd like ultimately that for next fiscal year that everybody have this format in addressing performance measures. Do you agree, Vicki? Yeah.
I like the couch potato part, though.
I do like the couch. Sometimes you missed the couch, but we like the couch.
It means
Right. I'm not, Vicki, what do you think?
I mean, that makes sense to me. Sometimes not all budget requests end up having a straight line.
I know.
But particularly where that exists, calling that out.
Yeah.
And having that be part of the thinking process is part of the goal.
Yeah. Yeah. I mean, ultimately, that's the connection, performance of the staff in the department. So thank you. Yeah. I did little brownie points there for you, Director.
Good. Well, there is another position I need.
I knew that
Would now be a good time to talk about it?
Is there any case where you're are you overachieving and you need to do a deduct? I know.
So actually linking the performance measures to the enhancements was response to the direction that Vicki gave me. I think she provided to all department directors to make that connection that it would be a benefit to you and members. Here on this performance measure, you see that the box for room for improvement is gray or black. There's no request here for anything in terms of dollar amounts. I thought it would not be an opportunity to tell you what we're doing and to be candid that in this case, we've done a good job with the performance measures, yet we need to commit time and resources to our adequate public facilities section of the code. And in that vein, we're actually having interdepartmental meeting with all the key staff citywide that are actually involved with us in doing these APF standards. And the other thing with respect to the current planning division is we have a couple vacancies that we need to fill, and we'll be filling them soon. I want to have them filled before the end of this fiscal year. So we're in the process of doing that. Next is community development. The number of occupied homes and rehabilitated, 3 was the benchmark, and under Teresa's leadership, the department did 6. The number of rental housing units rehabbed, the benchmark was 154, and that was really meant to connect to the Morris Blum project, and as you know, you may know, that project is well under construction now. So when that's completed, the benchmark will have been met. Back there. In terms of room for improvement, we're going to have to bring in a new person because Teresa Wellman is retiring after several decades of service to the city, and we'll have a challenge to replace her. Facilitate a positive business climate. That's the main goal of economic development. And Stephen Rice heads up this division. We have the number of business owners signed up for the ambassador program. 5 to 10 were established as a benchmark. 1 business did. However, the program has been disbanded, and it's no longer effective. Candidly, at this point, I don't know the full scope of the rationale or why, but it's not in effect right now. Number of business recruitment missions completed. 4 was the benchmark, but the staff has spent a lot of time doing these, and 45, in fact, have been completed so far in this fiscal year. Number of site visits completed per month, 5 is the benchmark, and we're doing about 1.5 on average. So we're below that. But candidly, you can see this standard, while it's not met fully, is surpassed by the other standard, which is there's a lot of overlap between those two. The number of businesses assisted per month, 20 was the benchmark, and we're doing about 24 on average. So Stephen and Hope are spending a lot of time with local businesses in Annapolis. And in the year ahead, we really want to begin incorporating Stephen and Hope more into the flow of our work so that we can benefit from their economic development experience and market realities. So we can bring more kind of data analysis and insights into our work with the Planning Commission and the City Council. And that takes us to the summary of the fiscal 25 budget request. And I guess we'll start at the top. I like to just focus on the 24 adjusted budget and the 25 proposed. Salaries and benefits, there was 4.6 million in fiscal year 24. With the 3 positions that I highlighted, the budget would be 4.8 million for salaries and benefits, almost 4.9. That's actually a 5% increase over the current year. Between fiscal year 24 to fiscal year 25 would be 5% increase. The contractual services, they essentially stay the same. Supplies and other category, we see a reduction from 583,000 to 318, and the capital overlay or outlay would stay the same. So the actual budget request for 25 is 5.4 million, which is actually $13,000, almost $14,000 more than last year. It's less than it's a quarter percent increase. But you might want to know what's in contracted service and supplies and others. If you do, I can take you through those details.
Yeah, we have a typo on our screen. It says city manager's office.
Oh, that is my fault. I'm so sorry about that. I used the format and I forgot to change that.
Too late. City manager gets the money.
He's a great guy to work for, I hear, so it's okay. Would the council want me to go through any details on these various line items?
I probably will come up in our questions, I think.
Okay.
Right? Yeah. And so are you ready? You're ready for questions?
You want to do this page first?
Oh, the next page.
Oh, there's one more page. I'm sorry. Okay. So a summary of the budget changes, the 3 additions that are proposed: the senior planner, and architectural plans reviewer, and assistant chief to historic preservation. The senior planners, one I mentioned already in the rationale. I think I neglected to say why we need another architectural plans reviewer, but that was listed in the kind of room for improvement. We have a consistent backlog of projects. We can never get ahead of the projects in building review, and we need more capacity in order to keep up with the projects. And I think you can appreciate that a lot of the projects the city gets are very complicated and increasingly more complicated as they become mixed use or adaptive reuse of historic buildings. These are not your straight up suburban model store along a highway. This is a very complicated review process. Plus, we have a continual flow of single-family housing and multifamily and residential projects that have to be reviewed. So the plans reviewer does a substantial amount of work, and this would provide us capacity so we can actually work with architects, work through the issues, meet in person if we needed to, but also just simply keep up with the workflow. The last 3 bullets reflect non-personnel changes. We're proposing to remove a number of the these bulky consulting contracts that are currently in our budget. There's a project for what we call Urban 3, fiscal impact type of study. It's a rather expensive contract. And there have been a number of contracts for comprehensive planning that are falling by the wayside now that the plan's done. And we're not proposing to replace those with more consulting contracts. In fact, my approach, if the mayor and council are in agreement, is to gradually build our own capability in-house to do the work that the city council demands, rather than the default going out to consultants. And we have the staff capability in terms of background, intelligence, experience, know-how, and will to do a lot of work. And this is coming from a former consultant. So we actually are not proposing to add a consulting budget. There are 2 line items for design work and design experience. That's mostly mapping and kind of architectural designs for projects that help us do work, particularly with comprehensive rezoning coming up. But they're not big consulting contracts like currently exist. We also want to have, we've also proposed a reduction in some of our non-payroll expenses, and we're focusing on customer service, training, and professional development. So we have a little bit more money in our budget for training, but we also intend to use all of it. In previous years, we've had $10,000, but we've not used anywhere near it. We're requesting $11,500, and we want to really use it this year and in the years ahead. And that's the last slide.
Okay. All right. I'm breaking my own rule here. I've 5 questions, but hopefully they're short answers. Now that I've complimented you on performance measures, I have a critique. There's nothing in here about enforcement. So therefore, there's no connection with, what you need to enforce better. As you know, everything comes down to enforcement. Is that addressed in another performance measure? It's not in the performance measure. I don't know how to phrase the performance measure, but I don't see anything on enforcement. And that tends to be one of the biggest critiques of residents. Am I correct, colleagues?
Let me go here. One of the most important things I did with respect to enforcement is to elevate the zoning enforcement officer to a position directly reporting to me. So if you see in the director's office on the far left side of the slide, it says zoning enforcement officer. That position was previously within the inspections and permits office. Now she works under me and directly responsive to issues. She briefs me every week on matters. So we've elevated enforcement to department level responsibility. So I take accountability now for enforcement. The other thing is that, as I mentioned, we've expanded the role of the building inspector so they do site inspections. So they're enforcing the approvals that have been granted, whether those approvals were administrative, by the planning office or by the Planning Commission or Board of Zoning Appeals. So they're out there on the sites now doing inspections, not just the buildings. So those 2 areas are meant to shore up our enforcement.
Number 2, what I believe has taken its toll, maybe a critique, is if you go to your, Article 6, Section 7 of your roles and roles and responsibilities, there's no mention of grants procurement, like getting grants. And I know, for a fact that Eric Lashinsky has been working feverishly on that. And then what happens is, the comp plan gets delayed. Have you, how do you juggle that? Do you know what I'm asking? Basically?
I do know what you're asking. Yeah, that's a good observation. The one that I've
okay. It is just an observation. I don't want you to add a grant writer, but it does seem, again, it's not something that's in your roles, but it obviously is something that you've had to take on. Oh, there's the city manager. Oh, it's the assistant city manager.
Yeah, Vicki Buckland, assistant city manager. So, yeah, I think your observation is apt. The way that I have observed anyway, that planning and zoning and some of the other departments have been dealing with that. There's been a bit of a handoff for some things from Eric to departments that end up inheriting, in some sense, that they end up with long-term responsibilities. That handoff's not complete, but certainly there have been some strides toward DPW having a greater role in some of the maintenance of those grants, reporting and stuff as they go along. And Department of Rec has also started to enter into those conversations as well. So I think I think they're trying to be a little bit more thoughtful about that initiation versus long-term maintenance.
I mean, obviously the revenue is beneficial. It's just that the expense is sort of skew.
Okay. Yeah, and the position that we talked about last week about the position, Jody's position, that is moving over to Public Works is part of that.
Okay.
Right?
Okay. What's going on with EnerGov? I'm not sure what you were saying. Do you need staff to supplement the complexity of it? And I thought EnerGov was supposed to be less cumbersome than. Well, no, I know, but wasn't it supposed to be better than How Soon We Forget? What was it, Ross? What was the old one? E-Track It. Yeah. I mean, do we have failure there?
The software has been difficult for the average person to use. There's no question about it. And to prove this, the staff made me an applicant and had me go through the process.
Right, I remember that. Yeah.
At each point, I encountered similar issues that the staff hears about from residents, particularly the sort of mom and pop type of applicants, the average citizen. And part of it is the software is not designed to be as friendly interface. I think future updates will bring that to pass. Others are the staff is grappling with what changes we can make internally and with the IT department. And we've made a number of those changes, and IT has actually published a whole series of guidance documents to assist people that we often refer to. However, still some people really need and want the attention to navigate through the system. So we've made a choice to provide that assistance to them to get them through the process.
You have to do what you have to do, yeah.
Yeah.
Okay. Yeah, expand on that, yeah, go ahead.
So I tried to get into an application. It was something before the Board of Appeals. I called the office. The young lady that's at front desk is very good, very responsive, tried to walk me through. But I eventually got bounced to Brian Paquin because we couldn't figure it out. And he initially couldn't figure it out either. And it turned out that I had to become a member of some grouping, and then I could see things that weren't shown to the general public, but were showing to people who registered. So, I mean, it took a lot of your staff time to walk me through a very simple request, and it stumped Brian as well. So,
right.
Definitely we need improvements, but your staff are great at helping us try to negotiate that.
In all fairness, I mean, when you introduce software like this, it takes time, but I would imagine at some point this is going to be really humming along and be a great public service. And other jurisdictions around the country use this same software, so we're not unique to this. Yeah. It's just a continual process of improvement and uptake. But once you're in the system, once you've used it, it's easy to go back to it and continue. And it allows us to get rid of all this paper. We're short of space because we have all this paper we have to gradually eliminate. This means everything's digitized. It's set aside for storage. It's there whenever we need to call upon it. So there are a lot of benefits that have come about through this software as well.
Two more. The tree canopy, is there an increase in the tree canopy in here anywhere? That's been a subject of
yes, there is, but you have to dig a little deeper. Okay. The proposal is to increase the tree canopy budget to $182,000, which was a $75,000 increase.
Okay.
And that would fall under the supplies and other category.
Okay. So it's in there.
I'm looking over for confirmation. The tree maintenance program, that's supplies and other. I believe it is.
We're getting a lot of public testimony on that. Public. Yeah.
I see it on page 69 in our budget book.
The director is correct. It's program and activities. It rolls up into supplies and other category.
Okay, so it's in supplies, so it's in there, okay. Sorry, my bad, I have two others. Is that, this might be more Director Dickinson, on the Housing Trust Fund, is that another pass-through, and that's why it's representative as that way? It's a negative number. Actually, on page 71 of the budget book, Affordable Housing Trust Fund budget summary, the revenues are $379,700, and the expenses are $937. There's a,
Madam Chair, if I may.
yeah, thank you.
Katie Connolly, Budget Manager. I'll let Jody speak on the breakdown, but visually what you're seeing there is the expense appropriation. So the way that OpenGov unfortunately does the reporting, the expense appropriation rate is greater than the revenue shown here. But if you go to the front part of the book, I believe it's page 22 or 20, you can see that we're using most likely fund balance.
So it does balance somewhere, taking it from somewhere.
Yes, the negative amount just tells you that the expenses are greater than the revenues we're anticipating.
Yeah.
Which implies that we're using fund balance for that purpose.
And that's on page 15?
Page 14 and 15 will show you that visually.
Page 14, yeah. So page 71 is showing us a negative, and then you're saying if we go to page...
Yeah, up into the front schedule section, you're pulling on the floor.
The fund... What is it called?
Where we show you when we're using fund balance for some of the funds.
So that's page 15, isn't it?
14, so I personally, I think 14 shows it a little bit better because it's showing you the revenues in excess.
Right,
Or-
so we're still showing a negative of 557,371, and then it has asterisk number 2. When you go to, if the fund balances in these restricted funds are not appropriated for the fund's restricted purposes, the city would not be able to spend the monies for the intended fund balance. So,
That's showing you the use of the fund balances.
okay, so we have a negative then.
No,
We don't understand. So there is a fund that has monies left over going into next year. And we anticipate in that fund, we're anticipating revenues of,
379, right?
hold on just a second. Yeah, 379,700 new money coming in. But we're going to spend more than that because there's a fund balance. And those earlier schedules that you're referring to do show you the funds that are using accumulated fund balance as a source. My most useful schedule, I would say, is 16. If you look at page 16, where it says, the second column on page 16 says use of available fund balance. And you go down to the Affordable Trust
Oh, there
Fund.
it is, yeah.
We have revenues we're anticipating of 379.
Oh, that's where they add up, okay.
We're going to use fund balance.
Okay.
And therefore, we're going to spend 937.
Okay.
This is the same information as on page 14. It's just laid out a little differently.
Okay. I didn't see the 379,700 is left over? Or where does that come from? It makes it balance.
That's anticipated new revenues coming into that fund, and that fund has a few different pockets in it now, and most of that is the occupancy tax that's going to the rental assistance program.
Okay.
There's a couple other components this year that we've added to it, and I think in '25 there's 4 different sources there.
Okay, all right, so page 16 shows it balanced. Okay, thank you. My last question, we hear a lot about, especially with city housing, a lot of reinspection. Have you done or will you do an evaluation of your respective fees to make sure that that cost is covered? Because I haven't seen any increase in your inspection fees, and it just seems to make sense that you've got to cover that cost. And if you feel comfortable, fine, but it just seems like you need to look at that. Or
Okay.
do you want, yeah.
Then we will, in fact, examine it, see where we are with that. And,
Yeah, right.
Okay.
Okay. All right. Any questions now that I've hogged my 5 minutes?
Well, I do have a couple of questions, but going back again to the Affordable Housing Trust Fund, and I'm between pages 14 and 16. And just to help me understand this, on page 16, the revenue, that's new monies that are coming in, are the 379.7. And then left over from the previous year, we had 557.3.
Correct.
So adding those two gives us the 937,000.
Correct.
Back on page 14, it appears as if the 557 is less.
Yes, because if you look at the column heading there, it's just saying that revenues are less than expenditures for that particular fund. And that just means new revenues. New revenues are less than the spending authority we're asking you to grant for this fund.
So it's not an over expenditure in that account.
Not necessarily.
And that's what it looks like, because we're used to seeing negative numbers in parentheses.
Right.
In this case, it is not a negative number. It simply shows us the difference between new money and old money.
Yes, and I will say that we included the presentation on page 16 a couple years ago at Alderman Arnett's request as to showing what you're spending and what the sources are. It kind of outlines the two sources, new revenues and the use of accumulated fund balance there. That's why it kind of lays it out a little bit clearer than the first schedule.
Okay, thank you.
Yeah, and you could say the same for AIPPC, right?
Right.
Yeah, okay.
Mr. Jakubiec, your enhancements, were they all included in the mayor's budget? Your enhancements, your requests?
The three personnel enhancements were, there are enhancements that are not really enhancements, but they're things that are waiting for the code and classification study to work out, and we're hopeful that consulting firm sees things the way we do. They have budget implications in some cases because the pay scale of some positions would be elevated, but I believe that's in the works, and that's worked out through coordination with HR and finance department, and I would imagine that's a budget discussion that happens beyond our office. There was a couple of non-personnel enhancements that I requested. One was $50,000 for urban design consulting to assist us in doing the planning and the site-specific planning for areas like future annexation areas or areas along Forest Drive that we need to be more proactive with. And I think that might have been the only. There was the enhancement for increasing the tree canopy work that's we've discussed already. There was a request for software, additional software for analytics, and we decided to step away from that request and maybe come back in a year from now with more information to better justify it.
So in essence, your enhancements have already been met, aside from the positions that are waiting for the comp and class study.
Yes.
So let me ask Ms. Dickinson, have they been accounted for in the mayor's budget?
Which one in particular? We gave them
The positions that are on hold, waiting for the comp and class study.
The only positions that we gave them this next year are the senior planner and the architectural plan reviewer. Those are the only two. If there's more in the comp plan that are pending, those haven't been included.
Did I say comp plan? I didn't mean the comp plan.
Oh, class and comp. Oh,
Class
okay.
and comp study,
Okay. So the class and comp study wouldn't be addressing whether or not there's other positions that are needed. They're studying current positions and whether they're graded properly. Am I saying that? Is that, that plan won't say, yes, your Department of Planning and Zoning needs more people. No. It'll say the people that you have in their positions, are they properly graded? Are you paying them at the right pay range, et cetera? Those are the kind of things they're addressing, not needs.
So do you have funding in the budget for the permits administrator, elevated permits administrator? Because that is one that indicates that we're waiting for the comp and class study. So is that already funded in the budget? That's my question.
There is a permits administrator funded here. I don't know if there's an additional one you're waiting for.
Just to be clear, the permits administrator is classified as A10, which is a clerical position. We're requesting that, as a matter of classification and code, that should be coded at A13, obviously, and that's not an issue that Jody handles. But the question is there money in the budget to accommodate that increase? And that the current budget doesn't.
That's my question.
So for anything that comes of the class and comp study, for which there is a recommended grade increase, we have set aside a reserve in our finance non-allocated section. And I'm not going to be able to say the amount. Katie will know the amount. Go ahead.
It's a little bit less than 200,000.
A little bit less than 200,000 to cover all departments, because we don't yet know the extent of what they're going to recommend. So we set that aside to cover some upgrades that would, if this position did get approved for an upgrade, that funding would go over to planning and zoning.
Okay, then
Can I
Go ahead,
interrupt? 'Cause
yes.
I don't understand. Okay, so on page 15 of the budget book, there's two line items I thought, so for clarification, we're talking about two different things. We're talking about bodies that we're adding. The bodies are in there, for lack of a better word, right?
Yeah.
The people. And then we're talking about the compensation of them. Because the comp study has not done, the finance department has done their best effort in putting in contingency monies or whatever for personnel, and then, you know, the union negotiations cover that. So I thought it was the one-time compensation line item for 600,000+.
So
I'm sorry.
that 650, that's the bonus stuff, right?
Oh.
So as we,
equity allowance.
if we move forward with those new pay scales, the number you're looking at is on page 15, and it's one of our use of our one-time reserves.
Correct.
That is the amount that we project we'll need if we put people on a new pay scale.
Yep.
And at the time, they're going to move on to a new pay scale, new step. And for some, that's going to be an increase in their salary. But for others, they won't see much of an increase because that difference between their current step and their new step is not that big. So we're trying to provide a bonus of sorts on July 1 to make sure that everybody sees at least a 2.5% benefit from that new scale jump. Even if it doesn't roll into their new salary, it at least gives them some extra compensation to try to even out
Right.
the jump onto the new scale.
Kind of an equity allowance.
Yeah,
So-
kind of like an equity allowance. And that's what that one's for.
Thank you.
Or did Mr.
Oh, I'm sorry. You should be able to speak. It's the third time you've been up there and not had anything to say.
Yeah, you can speak whenever you want to. Just have a mic.
Mr. Jakubiec, it is a rarity when a department head comes up and tells us they're removing something, like your consulting fees from the budget. So it's a breath of fresh air, so thank you for that. And lastly, and I sent you an email when you acknowledged your staff getting all of the commendations for their excellent customer service. And I suggested that they should be recognized as employees of the month. And I know there are some issues with groups as opposed to individuals. And maybe, Ms. Buckland, we could have a category of departments who are recognized for their exemplary customer service, because that's what we're all about. You know, we provide a service to the community, and when we do a good job, even when the community recognizes us, we should recognize our departments also. So I'm putting that out there, and I want you to thank your staff, the entire department, for being a good role model for us as far as community service is concerned. So, thank you, Madam Chair.
All sorts of compliments today.
It's nice to hear, but the accolades should be directed to Maria Brown. She's leading that charge. Really appreciate that.
It's important. Thank you, Ms. Brown. And yes, it is important. Absolutely.
Alderwoman O'Neill.
Thank you very much. I do have a couple questions, and I'm going to harp a little bit more on the staff and pay. because under zoning compliance officer, it just says to be determined for their grade. And is that included in those estimations? Ms. Connolly gets to.
Katie Conley, budget manager. We are waiting, so this was a new position last year, I believe. It got rolled into the class and comp study. So we have, so can you see those? I want to check our personnel listing. I believe the funding is in there.
Okay.
But I will return shortly.
Okay, thank you very much. All right. My next question is,
Oh,
wow.
we're adding the film festival into planning and zoning as a line item?
I see that, yes.
71. But that's not in the current general fund budget, is that correct?
Sorry, can you repeat the question? Film festival?
Yeah, so on page 71, it says Film Festival, 20,000 with special projects the department has requested funding. Is that included in the budget or is that?
I can answer.
Yes, it is.
I can answer that. Vicki Buckland, Assistant City Manager. So they currently have a community grant, but the reality is that the support that the city gives is really around economic development. And there are actually a whole variety of organizations through planning and zoning that end up getting funded, like the Downtown Annapolis Partnership and things like that. And so it's not brand new money. It's instead moving them out of the community grants and into that more economic development pot, which is really what the city's support is for. So it's realigning it based on the purpose of the funding, but it's not new funding per se.
Okay, so is that included under the summary? Is it included in the capital outlay or?
That'll turn to Katie.
It's included in supplies and other line item detail. You're going to look for special projects. So that is the area last year that had all of the alderman and alderwoman amendments. It's the 245,000 that I think went down to 20,000. So that explains that difference too in that line item.
Okay, so that's in supplies and other. And is that also on page 70, the urban design, the art district, the Downtown Annapolis Partnership, those are also in supplies and other?
No, ma'am, that's your contractual services breakdown. So it's the actual contract services line within that contract services category. We have a code requirement to break out what's included in that specific account.
Okay. And because there was a lot of discussion going on, the tree guy, for lack of a better word, I know he has a better title than that.
Arborist.
Arborist, thank you. I could not think of that word to save my life. We've requested additional funds for him. His last year's funds were $100,000. And where is that line item?
So it's $182,000 this year. That's in programs and activities, which is in, I believe, supplies and other.
Okay.
So are there two parts to, I'm sorry, are there two parts to that? There's the staff part and then the canopy part?
Yeah, he is a funded position, but this 182,000 that Katie just mentioned is funding for the programs for planting and maintaining trees.
Okay.
And it's a request that we increase it by $75,000 over last year.
Increase of 75. Okay. And my last one, because I've been giving a suggestion to everybody else, not a question. I know that in recent months, we've had discussions about our inspectors and the fact that we have one building inspector, one electrical inspector. Is it possible for us to take a look at possibly partnering with the county when a big inspector is on vacation, or looking at contractual services for that?
I think so, yes. We should look at that. How about if we take that under advisement and prepare a memo to get back to the council? We'll have to contact the county, see if that's a viable option. But there might be other options too. But
Correct, right. A temporary inspector?
yeah, and what happens is when inspectors may go on vacation, because we run such a kind of close shop, if someone's out on vacation, we can't fulfill the inspections under that person's portfolio, and we're kind of stuck in a waiting pattern for a period of time. So
Right.
this would help resolve that.
We've seen that most recently with some of the newest development in Annapolis.
Yes.
And I think it's hurting us. Do you want to add to that?
I didn't push that button, by the way. No, I didn't want to cut him off. I think that's your timer for the.
It's all right.
It's okay.
Okay. I just wanted to respond to your earlier inquiry. I made it harder than it needed to be, right? So the zoning compliance officer, they have the position, but there's not funding, right? Because we don't know it yet. That's why there's that TBD. So I just wanted to answer your question there.
So that's a new position that's not funded.
It's a new position from last year, but because we don't have a grade, right, we didn't put funding for that particular position in the budget. But once we get a grade and they need to fill it, then we'll have to find funds for
So
that.
we don't have a body in that position at the moment.
No. Not the enforcement director, the zoning compliance officer. You have zoning enforcement officer, excuse me.
We didn't realize that candidly that position existed, but we'd be welcome. It would be a welcome addition to what we're doing. And if it gets funded, all the better. We would fill that position. Wasn't part of our request, and I didn't realize that.
Body or money compensation?
So from a staffing summary standpoint, this was a position added last budget cycle.
Okay.
We don't have a grade yet for that position.
Yeah.
So we aren't sure where to fund it at. So they have a position for the staffing summary, but there's no funding in the budget because we don't know how to.
I thought that we just addressed that in what we were talking about before,
It's part of the class and comp study?
Yeah, I thought there was hold money in the budget.
Oh, yes.
For the exposure.
I'm talking, sorry, within planning and zoning.
Oh, okay.
I'm sorry, yes.
Okay, so there is a body and compensation estimated.
There's not a body.
It's a vacant position.
Well, it's a vacant, but the money is in there. It's, right?
It's not in the department.
We could use that funding for this.
The 200 or the 656?
The 180, it's a little bit less than 200,000. It's like 181,000,
Okay.
yes.
I wrote 200 because.
In the non-allocated.
In the non-allocated.
Correct.
Okay. Are you clear, Director?
I'm clear. I'm following what's being said, but I was not aware that this position existed or that it was approved last year. And we've made changes in-house with the understanding that we didn't have this capability. As I mentioned, some of the other things we've done with our inspectors. But if push came to shove, we'd much rather use that $200,000 to support the existing staff we have to elevate them to the important roles that we need, rather than having another body per se.
Well, the $200,000 is not all yours.
I know. That's what I'm saying. But if it were, it's true. It's not ours. But if we don't have the position, I can't ask a permits administrator to act like a permits administrator and pay her as a clerical worker. So, we don't do permits administration if this position is not classified as an A13. Moving forward, we're going to have a continuation of the problems that we've I've encountered since I started here.
So are we talking enforcement or inspection? 'Cause I know
Compliance.
Compliance, okay. Because last year, I only remember in the amendment, the budget amendments, that we added a part-time enforcement person that we were never able to fill, or we filled and they left and all that.
Believe during the amendment process, you added the 2 alcohol enforcement positions.
Yes, okay, okay.
And those are here on this staffing?
Yes, ma'am, at the bottom on page 70.
Okay.
Bottom of the staffing summary.
There too. They're funded, but zoning compliance officer, we don't have a body and it's not currently funded, but if we were to fund it, it would come from the $200,000.
It could.
Non-allocated.
It could. I mean, think about our total comp package too, right? That's salaries and benefits. I don't know if that could fully fund that position. I'm not sure where it's going to land, to be honest. That might be a question you might want to talk to Ms. Hopkins tomorrow about.
Okay.
I have to interrupt and say that my son just finished the Boston Marathon.
Hey.
At 2 hours and 52 minutes. Okay, continue.
Okay. That was all my questions. Thank you.
Yeah, that was Devin. Yeah, okay.
All right.
It was a little warm. Okay, next.
We'll celebrate it.
Alderman Arnett.
Thank you, Madam Chair, and thank you, Alderman Arnett. Do we have a weekend, what we used to call a weekend inspector? We do.
Yes, we do.
Okay, all right, got that out of the way. The other thing is Alderman Shandemeyer, and I cannot think of the name of the program, incubator, but that's not the right word.
I know what she's talking about.
Economic government. Do you all oversee that or administer that?
Yes, Stephen Rice does.
Okay. And the last thing is I had joked with Mr. Director here before. I said he could enhance his presentation if he had a mascot like Rec and Parks. But I like the room. You got it. The sofa.
Okay, right.
Okay, that's good. That's it.
All right, Alderman Arnett.
Thank you, Madam Chair. So I have a couple of quick hitters. I have a lot of things noted, but the first one, I was interested in your mission statement, all of the different parts of the code, and I actually think you touch on a little more than this.
Yes.
Like Title VII. But I was curious because the Planning Commission doesn't advise on all of these. I'm not sure they necessarily should, but I'm certainly been working a long time on changing Title 15 for harbors, harbor lines and things like that. I think if the comp plan is successful, Title 18, landlord and tenant relationships is going to grow in importance. And if it isn't the Planning Commission, I think we do need to have somebody helping us look at that. So your presentation just tickled that thought. But getting to the specifics, we had an editorial in the Capitol last week about inspections and about inspections of public housing. And it was critical of us in terms of the inspections. I didn't think it noted that the fact that we're under a court order that we have to comply with, but how are we doing on expediting those inspections? Is that moving along apace?
Yeah, there are roughly 185 units that are not actively licensed within HACA's total portfolio of units, which is close to 600. So about 185 are not licensed right now. And internally, we're setting a goal to knock those out as quickly as possible, to work to focus our inspections and permitting on bringing those online, which requires us to take a different approach to inspections and license renewals. And internally, we're working through those matters with the HR department now, working on job descriptions and to get things set. But we actually think that we can change what we are doing in the office without bringing on a new person and to provide enhanced focus on HACA's license renewals and inspections. So that's in process now, and I can't say much more about that right now until, it has to be more of a coherent response involving a lot of other people, but that's where we are, and we're working with HR.
Good, because one of the ambiguities, to be charitable, this is bringing up is whether or not residents have to pay their rent. I don't think there's any true ambiguity, but not being in an inspected unit is one of the, I think only 40% of the rents are being paid that are supposed to be paid, which is certainly adding to the dire straits. So I want to put in a pitch, anything we can do to help the situation at the Housing Authority and any help that the council needs to give you to be able to do that, we really want to do that. I noticed on page 6 of your presentation, one of the bullets that I didn't hear, I thought got skipped over, was open the office to meetings with architects to work through issues face to face, which has been a long-term bone of contention about agreements with architects on projects that the public are not necessarily involved in. And I'm only going to bring that up to say that it is a sensitive area, and I didn't know whether I didn't hear something about that because it's a sensitive area, or if there was some other.
I skimmed through that slide real fast, but it's there's a different way of interpreting that comment. And what that is referring to is after projects have been approved, when the actual nuts and bolts of building and architectural design are being worked out, which is such a detail level between professionals in design, structural analysis. That's a hard thing to do by recording comments on EnerGov and having the architect respond by written comments and then have revisions discussed and back and forth. What we want to do is acknowledge that COVID, the crisis is over. We can have our colleagues come into the office to discuss the details of building design among professionals and expedite projects.
So that would be an important clarification.
Yes.
Because people, our constituents do read these things.
Yeah. And just to clarify, that comment is under inspections and permits, not under current planning where development projects are talked about. But we were very clear about there's transparency, which is an item that we cherish in the planning department.
Two other big planning issues. I know it's subsumed under economic development, but it used to be that we had a lot of focus on women and minority health business. And I may be just not in the right place to hear what's going on there. I know that Hope, I believe, is working on that, but it was one of the really important aspects, and it was part of the Main Street program thing. So I guess I, for one, would like to hear how we're doing on helping those particular businesses. And then I know that there was at one point a rewrite without involvement of any of the city council of the adequate public facilities ordinance. And in my view, the APF do need improvement. One of the things that Teresa Sutherland and I happen to agree on, how we actually get that was another question, but I think APF is an important part of comprehensive planning, because APF, in my mind, is how we make sure that we have the facilities for any increases in density or other changes in zoning, like, for example, annexations. Make sure that we have the facilities. And so I would, for one, would really like to be brought up to speed on where we are in terms of planning changes to Title 22, the APF. I think it's going to be critical, and it's going to be a critical part of how we come up with the final comprehensive plan. So there's other things, but I know we're over time, and I'll just write to the chair and bring up some other issues. I am concerned about the staffing, whether you still have enough. Adding 3 more people is good, but planning and zoning along with fire were the 2 departments that got most heavily hit when we were in our near bankruptcy circumstances back in 2008, 2009. Fire has recovered. I just talked to the chief about that this morning. Plus, he wants a SAFER grant to get 4 new people. Planning staff, and we lost a very good young architect back then, really got hit hard. After gunfire and potholes, land use really is what we hear from our constituents about, and I want to make sure that we have a robust planning staff that gives you the resources you need to get the job done. So, and again, thank you. I think our department so far have done a really great job in helping us with the highlights of their programs, and you did as well, so thank you for that. And I would second the notion that coming up with more emphasis on code enforcement is really something that will go down well with my constituents, and I think others as well. But thank you for the presentation.
Allow me one quick question. The Downtown Annapolis Partnership, the $50,000 allocation, what is that exactly? Is that for someone's salary, or is that of the programs themselves? That always comes up from my constituents.
I think it's programming, like lights and landscaping improvements and activities that cost money for the partnership to put on in the downtown area.
Yeah.
Our role is generally limited to processing a payment. We're not engaged in any day-to-day interaction with the downtown partnership.
So here's the money and spend it how you will. So the only reason I asked is that if it was a staff allocation, then theoretically that person works for the city, right? Yeah. But this is more of an allocation of funding.
This strikes me as a priority that City Council at some point established, and it seems like it's reasonable to put it in this particular budget among all the other places you could put it. And
it's always been a mystery to me because it was some kind of spin-off from the Main Street program, and I don't know, and that was state funding, and we don't have that anymore.
But we did have a contribution to that from the beginning.
Yeah. Oh, we do. Do we?
There'll be
Do we get money on that? I'm sorry. Do we get grant money from the state on Main Street program?
But we don't get it. They get it, I believe, don't they?
Okay, that makes, okay, so it's not in the grant. I didn't see it in the grant, so, okay, not to confuse you. Okay, well, we have some mementos for you, and promise me you'll look at your fees to cover those re-inspections.
Thanks so much for wonderful presentation. Thank you.
Oh, you mean a separate list instead of in each department, the contract? Yeah.
I brought that. Oh, okay.
I used to throw them, but I used to hit Katie in the head.
Can you tell us where it is?
It's in every section of the book. It's a contract services breakdown.
Every department.
Every.
Is there a way we can pull it together so we used to get a sheet.
Ross's mic is not on.
All the contracts.
Mr. Alderman, your mic's not on.
Oh, sorry. There used to be a sheet that showed broke out all the contract services across the city, and it was broken down by department. Now, if you want to look at contract services overall, you have to pull it out section by section and add it up.
So
Would that be an open gov? Could I find it there?
He just wants all contracts on one list instead of how they're shown now under each department.
You still want I mean, it would make sense to me, you would still want the departmental breakout, right? Like you want, but all in one spot.
That
is
would
what
be
you're
very
asking.
helpful.
Okay.
Well, thank you very much. Thank you for staying a little bit later and a great presentation and setting the template for performance measures with the couch potato.
Thank you. Your mic.
That was all. Thank you.
Madam Chair, is this appropriate for me to make a request?
Yeah, I was hoping the city manager would be here, but the Director of Finance would be here, but Katie can take care of this. We have some general requests on the budget book. Go for it.
On page 34, the staffing summary, position count. 34? Uh-huh. There is no column that indicates existing staffing. That is only staffing for 2025. So could we see?
What page again? I'm sorry.
34.
On page 34, summary, staffing summary, position count.
So you want to know how many of these positions are filled and not vacant?
No, I'd like to know how many positions were in the 24 budget
Comparing 24 to
compared to the numbers that are here. These are the 2025 numbers.
Okay.
Yeah, we used to have a table that showed it over time.
Right, and maybe you have a separate chart from last year that gives all of these numbers.
Right.
I hadn't thought about all of the categories, but it may be helpful to see the exempt, the civil service, et cetera, so we can see how many we're moving into civil service.
Okay.
Yeah, so it's
Thank you.
She has
Yes,
that
ma'am.
information, she just needs to show it.
Did you have other requests?
No, I think that's it.
That's the
Okay,
one I
so for
had.
tomorrow, I have, make sure I'm working off the right schedule now. Just two presentations would be the human resources in the morning and transportation second, and then no afternoon.
And were you
I couldn't
going to
put
add?
services. Okay, we'll have an.
Oh, yeah.
Yeah, HR and transportation tomorrow. Okay, so if
And
there's.
where, I'm sorry, were you talking about adding central services tomorrow?
Yeah, and I think I had the wrong schedule, but I think it still works. We're thinking of adding them Monday morning because the city manager's available the 22nd.
Okay.
So we're going to amend this to have them from 9:30, to 10:30. And then
Okay,
just shift
excellent.
everybody down. And so Director Simmons will be right after lunch.
Thank you.
Thank you for that. Thank you for asking.
And we double checked with him,
We double check with who? Huh?
Director Simmons.
Oh, yeah, can you check with the respective departments on that? Make sure it's okay with Kevin that he goes at 12:15 instead of.
Is it Kevin? I thought it was Public Works.
Him too. Well, he shifts and then Kevin shifts. The two
Oh,
shifts.
we were looking at an old one because it had HR. It must have been the old.
Yeah, I know, it was the old one.
No, this is the one we were looking at to move
Yeah, tomorrow
central
was too short
services.
notice to get it on tomorrow's
Yeah.
agenda, so we'll see if that works.
No, I think we were looking at your old.
Right, you were, yeah. Go ahead, Kate, are you okay? Okay, if there's nothing for the good of the order, I will accept a motion to adjourn.
Move to adjourn.
Second.
All in favor signify by saying aye.
Aye. Thank you.
Meeting adjourned. Thank you.